lung health, and it's very important for patients. And so we want to make sure that all of you today feel informed, inspired, and empowered. And we do plan on holding other events, as Zarana said, but we'll focus on other topics in the area, and we'll be asking for your input later on in the day. Just going to give a brief outline of the agenda for the day. You can see the program on the ELF, the European Lung Foundation website, and I think there's a link in the chat to take you to that if you want to see it there. There are 8 presentations altogether. As mentioned, I'll chair the morning session together with Zarana, and then Barbara Hoffman, who's the chair of the ERS Advocacy Council, will join us for the afternoon. And our job is to introduce the speakers, keep track of time, make sure they don't go over time if possible, and coordinate questions to ask at the end of each session. There's time allocated for questions after each session, not after each speaker, but after each session. So please write your questions in the Q&A box near the bottom of the screen. There are 2 boxes, a chat and a Q&A. If you could please put your questions in the Q&A chat, that would be very helpful. So the first session is going to be on environmental factors that did influence health outcomes, starting with a presentation from Professor Mark Nieuwenhuizen. Mark, I hope I said that right, with an overview of the environmental issues specific to urban settings and how they are impacting our health. Then we're going to go on to watch a video from Mary, a 16-year-old with severe asthma, and her mother Marta, on how air pollution impacts their daily lives in Athens. That's going to be followed by a presentation on the science behind the impact of air pollution on the health both of children and through our lifetime by Professor Ulrika Gehring. We're going to move on to wood burning, a presentation by Cora Christensen on the impact of wood burning in cities, followed by the personal story of Natalia, who received a double lung transplant and used to live with pulmonary hypertension in Sofia. Then we're going to have lunch, and then after lunch there'll be a presentation by an organisation called Ride of Their Lives on how you can engage healthcare professionals and patients in advocating for clean air. And the last 2 sessions of the day are going to be on policy changes presented by the European Environmental Bureau. And finally, but not least, a presentation on healthy lungs for life from Catherine, the importance of engaging the public in advocating for better policies, understanding our impact, and what we can do to support clean air policy. And this is where we're going to be inviting you to support ELF and what it's doing. Okay, I think now it's back to Zarana, and we're good to go with the first presentation, I think. Nearly.
Thank you, Phil. I know we're all keen to get started. Just a few housekeeping notes. Chat and question and answer. We encourage you to engage and be interactive in the chat. And you can also say hello to us from where you are. I think that's all already going on well, and very good to see so many people from all around. You also, so I think we'll move on with our program. And the first speaker, and quickly we would just like to introduce the poll and to hear which country you are coming from and what kind of stakeholder you are. And how much do you know about impact of air pollution on lung health? And this will help us set the stage for this event. Okay, and I think then we'll move on to our first speaker. And it's my great, do we need to give a few more seconds for the poll? Are we ready to go? Here we go. So I'm very pleased to see quite a mix of audience here. We have very good representation of both patient and patient organizations and health professionals and some other interested in the topic. And quite a lot of variety on background knowledge on this topic. So we are very happy to be able to engage with all of you with different background in the topic and hopefully provide a lot of opportunities to learn today. All right, so it's my great pleasure to invite my esteemed colleague and a friend, Mark, who is a research professor and a world-leading expert in environmental exposure assessment, epidemiology, and health risk and impact assessment, who has a strong focus and interest on healthy urban living. Mark is a director of the Urban Planning, Environment and Health Initiative and head of the Climate, Air Pollution, Nature and Urban Health Program at ICE Global in Barcelona. Mark, the floor is yours to tell us more about what can we do to make our cities healthier. Go ahead. And you please share the screen and let us see if it
so much.
works.
Oops. Let me see if I can share my. I think then you need to go away with yours. Oops. Now I see. Oh, what's happening now?
And Mark, while you're doing this, we'll just encourage you to put your questions in Q&A. There's a team of people who will be answering as many questions as they can throughout the day, and we'll have also Q&A session after Mark's speech. And please, as you watch, and if you're on a social media, tag ELF in your post, and you can use the hashtag BreatheCleanAir2025 to share awareness about this topic and information about these webinars. And all of these talks will be recorded and available to you on ELF YouTube channel. So thank you, and go ahead, Mark. Seems that you're ready to go.
Thanks so much, Sarana. You can see my slides and you can hear me well?
Both, yes.
Excellent. Thanks so much, and hello from Barcelona. Sunny Barcelona today, although it's still a bit cold. So I'll talk a little bit about environmental factors and health in cities and how we can improve our cities. I focus more on mortality as a main outcome, but it's also representative of many diseases. Later on, Ulrike will talk about specific respiratory health for this. First of all, I would like to draw your attention to a paper we did not so long ago, written in the Lancet Respiratory Medicine Journal, where we looked specifically at this topic, how we could shape urban environments to improve respiratory health. What I'll talk about here has some of the elements that we actually discussed there, but if you want to read a little bit more about it and a bit more relaxed context, you're welcome to read the paper. If you can't get access, I can send you one. My email will be shown later. Also, at the moment, I'm leading a large project. It's called the Urban Burden of Disease project for policy making. This is a project where we look at environmental factors in cities in relationship to health, including air pollution, noise, heat, green space, but also physical activity, and try to estimate the burden of this. If you want to know a bit more about the project, on the bottom is the website, where there's also quite a lot of useful information. We have also a number of case city studies where we specifically look at interventions, how things can improve in the cities, what may be interesting as well for you as an audience. If you have any questions, again, please contact me. Here you can see the cities. They're all spread around Europe, large cities, small cities, where we get a lot of information from. As part of the work, I mentioned we try to estimate what is the current burden of disease related to environmental factors. We use a so-called health impact assessment methodology. It's given here. I don't expect you to understand or look at it, but it's a well-established methodology, what I'm often asked for, what is being used. In general, the kind of framework we're working under is that there is a relationship between how you design a city, how people get around the city, how this leads to environmental exposures, and how this leads to disease and death. And I think this is, the kind of overall story. It's, how our cities are designed is what we experience. So, for example, if you design a city for cars, if you make a lot of infrastructure for cars, roads, parking, etc., you get a lot of people going by car to the city, what leads to air pollution, but also to noise, heat island effects, because the pavement is in cities is warmer than absorbs more heat and releases more heat, so the city centers are warmer. Also, it leads to more stress, less social contacts, and also particularly less physical activity. What leads then to disease? A range of different diseases, including respiratory disease and ultimately premature death. On the other side, if you make a city more or create a city more for active transportation, so put in infrastructure for walking and cycling, for example, people may cycle more, there will be less air pollution, less heat island effect, less stress, more social contacts, and particularly also more physical activity. What is also important to prevent disease and prevent premature death. So I'll talk a little bit more and give you some examples about this, but this is to think about it as the overall framework, how all these kind of things are linked within cities. As Sarana mentioned, air pollution is the main environmental health risk. She already mentioned all the different impacts or health effects of air pollution. I mean, here you can see it in different figures. What are the impacts? And we know that it now affects every organ in our body, and therefore it's very important try to reduce air pollution, because there is no safe limit level for air pollution. But we still have a large problem at the moment, in particular in our cities. Air pollution levels are still way too high. Now, you may be familiar when we talk about air pollution, we talk about everything together, but there are actually two major air pollutants. One is fine particulate matter, so-called PM2.5, particulate matter of a cutoff diameter of less than 2.5 micrometers. And the other one is nitrogen dioxide. And actually the levels in the different cities and the distribution around cities is quite different. For example, for fine particulate matter, in particular Northern Italy, Eastern Europe, Czech Republic, Poland, they have fairly high levels of fine particulate matter, partly because of the kind of residential household heating that they use, but also geography, climate conditions, etc. On the other side, when you look at nitrogen dioxide, you see that the pattern is quite different. It's more Western Europe, more the bigger cities. I'll show you some cities soon where you get this much higher level. We estimated that in those 1,000 cities, you could prevent up to 200,000 deaths each year if you reduce the levels of air pollution in the cities to the lowest level experienced in some of the Scandinavian cities. Scandinavian cities normally do better, and so you could prevent a lot of deaths. In particular for fine particulate matter, you can prevent almost 125,000 deaths each year, followed by nitrogen dioxide, 80,000 deaths. So here are some of the cities with the highest mortality rate related to fine particulate matter and nitrogen dioxide. And as you can see, these are different cities. So the PM2.5, Northern Italy, Brescia, Bergamo, Czech Republic, also Poland, Ostrava and Czech Republic, where there was still some coal burning going on. You see very high levels and related mortality in those cities. On the other side, where you have nitrogen dioxide, it's in large cities with a high traffic density. Madrid, Antwerp, Paris, Barcelona here. You have a lot of traffic in a very small area. And that's partly responsible because there are different sources for the different pollutants. Here you can see that if you look at what I said, for a high traffic density, about half the nitrogen dioxide actually comes from the transport sector. I mean, and to a lesser extent from industry, energy, residential heating, and some shipping. So still a variety of sources, but the main contributor is traffic, in particular motorized traffic in our cities. When you look at fine particulate matter, it's actually residential heating that's leading it, but also agriculture. I mean, perhaps surprising because it's outside the city, but a secondary formation of particulate matter that reaches the city. Followed by industry, and then transport is only fourth in this category. But you can see that there are many more sources, and that means also it's actually more difficult to reduce air pollution levels from PM2.5 because there are so many sources there. For the rest of the talk, I'll focus a little bit more on transport because that's in particular where we have a particular problem. And it's, of course, not only air pollution. The cities are a kind of a complex situation where you get exposed to many exposures. I mean, when we were talking about air pollution, you at the same time think about noise. This here, what you see on the photo, is one road in the middle of Barcelona. It's like a motorway in the city. where you see a lot of cars, it's a lot of noise. There's a bit of green space, but not so much. But it's not a very nice situation to be in. We estimated that in Barcelona, we've got 3,000 premature deaths annually due to what we call suboptimal urban and transport planning. As what I said, air pollution contributes quite a bit, up to 700 deaths in the case of Barcelona, but also the lack of physical activity. Unfortunately, many people don't have enough physical activity, and we know that physical activity is extremely important, or it's essential for good health, including respiratory health. Also, we see that there are quite a lot of deaths, around 600 because of noise, then because of 400 around heat island effects, because we have so much asphalt, so many buildings that absorb a lot of heat during the summer and then release it during the night in particular. And then also the lack of green space. We see more than 100 deaths. So you can see it's not only air pollution, but it's a whole lot of different factors that actually may lead to premature deaths. If you look on a Europe-wide level, I mean, that's what I said, there are 200 deaths due to air pollution in these 1,000 cities. Actually, when you look at green space, also you see up to 43,000 deaths as a result of the lack of green space in our cities. 60% of the population in our cities doesn't get enough green space, according to the World Health Organization. Also, 60 million people suffer of noise levels that are harmful to health in the cities, and around 20,000 people die each year because of extreme heat in the cities that we looked at. So you can see there's a variety of exposures that actually are detrimental to health, and we should actually work on this. My personal belief is that one of the problems is our car-centric urban planning, the domination of cars in our cities that cause pollution in terms of air pollution, but also noise, and take up a lot of space that we actually could use in a much better way. Could we replace cars with trees? It would be a much nicer environment to be in. Also, in particular, when you look at cities in the south, if you get more trees, more green space, it reduces the urban heat island effect, what is important as well. And of course, I mean, it gets people out, what is nice as well. Therefore, we should be looking also in our current cities to introduce new urban models, what I call them. And here I've given a few examples of what's been implemented over the last few years and also studied to some extent. And that are the low traffic neighborhood, the Barcelona Superblock, the 50-minute city in Paris, and also the car-free neighborhood in Freiburg. And I'll give you a little rundown. The low traffic neighborhoods, in this case, I mean, what you can see here on the picture on the top is where they close off certain roads for motorized traffic. So you can only go with walking and cycling in those roads. And what we've seen, they've been in particular implemented in London, but also other places around the UK. And there we see actually a reduction of traffic within these neighborhoods and also a reduction of air pollution there. Also, the other thing what we see, there is more physical activity as a result of implementing these neighborhoods. And the good thing is also we don't see an increase in traffic and air pollution around this low traffic neighborhood. Often people think from, the traffic is just being displaced, so people can't drive on this road, so they go on the next road. Actually, that's not happening because, when it make it more difficult for people to drive, they just don't drive. Many of the journeys that people make, car trips, are not really necessary, and they're only being made because they can be made. So here in the UK, there was quite a bit of resistance to the low traffic neighborhood, but based on the results, the Guardian newspaper said from, spread the work, actually the schemes work. I mean, unfortunately, there are still a lot of urban myths around the issue of low traffic neighborhood, but I think when you look at the research, it's quite positive. The other model is the Barcelona Superblock. On the left side, you can see what the kind of system we have, or what was before. We have a grid system of traffic in Barcelona. Traffic goes up and down, left and right, all one way. The idea of the superblock is to cut off 4 junctions in the grid and only allow active transportation inside there, walking and cycling, and sometimes also car that can go at very low speed, and also put in more green space. This is an example. This is the superblock in Sant'Antoni. On the top, what was it before, and at the bottom, what was it after the implementation of the superblock model. You can see more green, fewer cars. There are not many people walking. It's in the afternoon, probably still siesta time, but you get the sense of what actually is happening. The idea was to implement 502, 503 superblocks in Barcelona, and we estimated that this would overall lead to a reduction in car use, a reduction in nitrogen dioxide exposure by 25%, a reduction in noise, particularly also an increase in green space, and a reduction of surface temperature. And it would prevent almost 700 deaths per year in Barcelona if they all would be implemented. Unfortunately, only a few have been implemented, but we estimate that the benefits for health would be very large, with the largest benefit coming from a reduction in air pollution, what accounted for almost half of the deaths that could be prevented. We underestimated the deaths that could be prevented by physical activity because we didn't have any very good data for it. But you can see by changing your urban model, by changing our streets, that can have very large benefits on health. Oops. Then the other model that's quite popular is the 50-minute city. The idea is that all your destinations, shops, cultural events, schools, etc., should be within 50 minutes of your home. It's a particular Paris where they're implementing it. Where they implemented it there, it's in a way that they put more events, more destinations in the neighborhoods where they were not before, so people don't have to travel so far. But we haven't seen many health studies for this, but we've seen some studies where they show that some cities, particularly European cities, you see more kind of this concept of 50 minutes being applied. But if you go to North America or so, you almost don't have any 50-minute cities because everything is by car and everything is by long distances away. So there's still a lot of improvement to be made, but it's something that's been introduced over the last 2-3 years since COVID. And so we're looking to see where it's been implemented, what are actually the health benefits. But as a concept, it's very positive. And then finally, you've got the car-free neighborhoods. My favorite example is Vauban in Freiburg. This is the neighborhood with sustainable housing, lots of green space. Cars are not allowed in the neighborhood. It makes a completely different living. And if you want to experience what a neighborhood could be without cars, go to visit Vauban in Freiburg. And you feel that, city living could actually be quite different. Now, what we also see is that many cities are starting to introduce 30-kilometer-per-hour neighborhoods or over the whole city. In the Netherlands, the 3-4 of the large cities, they're introducing the 30-kilometer neighborhood. And that's good in a way also for health, because, the problem is it allows more also like active transportation, more cyclists, because it's much safer if the speed is much lower. Also, of course, it reduces traffic injuries quite a lot when the speeds are actually lower. So this is another model that's being introduced, probably easier to introduce than the other models that are out there. Finally, the other methods that have been implemented to reduce air pollution and cars in cities are the low emission zones and also kind of congestion charging. And there are a couple of reviews recently that actually show there are large benefits or considerable benefits, I must say, by introducing the low emission zone on air pollution levels and finally also health. So they actually work as well. Unfortunately, or fortunately, I don't know how to say this, a lot has been bet on the electric car. When you look at actually what government's trying to do is try to get you out of your internal combustion car and move you to electric cars as a kind of solution to reduce air pollution and other things. But I don't think this is the solution, particularly not in cities. Outside cities, yes, but inside cities, you know, there is still, although the electric cars don't have any local nitrogen dioxide exposure emissions, there are still emissions for particulate matter from cars and from tires and brakes. So you still have a problem there with particulate matter. Also, you know, people don't get physical activity sitting in the car. I mean, that electric car in that way is the same as an internal combustion car. I mean, and also the car still takes up a lot of space that actually could be used in a much better way. So for me, it's not that we should go for cars, but what we should be looking at is to get people to public and active transportation. And what we know is that 50% of car trips are generally under 5 kilometers, so they could be easily replaced by cycling. But I think the problem is that often, you know, the culture is not there to do this, and also the infrastructure is not there for cycling. What is a shame, because we know that cycling has a lot of health benefits. You know, it reduces cardiovascular disease, premature mortality. If you cycle, for example, to work, you combine going to work, commuting with going to the gym. You don't need to go to the gym. It's less air pollution, less noise, zero CO2 emissions. Also, it uses much less space. And we know that cyclists are actually happier than car drivers. Also, what we know is that the benefits of physical activity well outweigh any risks that you may get from inhaling a little bit more air pollution or from accidents. I mean, the benefit cost-benefit ratio, it's around 70-1. For me, a very nice example of a city where they've been very successful to get people to cycle is in Utrecht. It's amazing when you go there. I mean, I used to go there 20, 30 years ago. It was still car dominated. Nowadays, actually, you see many people cycling and actually very few cars around. But this has been a policy that they've implemented over the last 15, 20 years to do this. Part of this is to provide safe cycling infrastructure, what I believe is essential. Here we look at more than 160 cities in Europe, where we look at the relationship between the availability of safe cycling infrastructure in the city per 100,000 people and the percentage of trips that are taken by bicycle. So what we see there is almost a linear relationship between the availability of cycling infrastructure and the percentage of trips by cycling. So up to about 1 out of 4 trips by cycling, so 25%, you see this linear relationships. Over that, it breaks down. Probably other factors are more important. But it shows to me that, you know, if you provide safe cycling infrastructure, people actually come to cycle. I mean, that's what we often see. I mean, what you create infrastructure for that is what you get. I mean, if you create infrastructure for cars, you get more cars. If you create more cycling lanes, you get more cyclists. We also estimated that in those cities, you could prevent over 10,000 premature deaths each year if you would increase the mode share of cycling up to 25%, so 1 out of 4 trips by cycling. So this is a quite large impact, benefit you may actually get from getting more cycling lanes. But as what I said, it's not only the issue of transport in this way, but also what you do with the space. And, nowadays, space is very precious in our city, and there is a fight for space, and we need to use it in the best way. I always like to promote green space, because green space, also what we know nowadays, has so many health benefits. It reduces cardiovascular disease and cancer, reduces air pollution levels, noise, it promotes physical activity, improves mental health, and also decreases the heat island effects. And overall, what we see also a reduction in premature mortality where there is more green space. So we need to have more green space in our cities. And one of the kind of aspirational rules that surround what I like a lot, what many cities are implementing nowadays, is the 330-300 rule. This is a rule that Professor Cecil Konijnendijk came up with, where he suggested that everyone should be able to see 3 trees from the window, live in an area with 30% green space, and live within a large area of large park of 300 meters. So, this is quite ambitious, but unfortunately, quite a few cities are implementing at the moment or trying to go into this direction. We looked at this rule, how it was related to mental health in Barcelona, and found that people that achieved this rule had a much better mental health than people that didn't achieve. Unfortunately, only 6% of people in Barcelona achieved this rule because the city is quite compact and we give so much infrastructure away, or so much space away to infrastructure for cars. As what I said, the other problem, what we see in particular with climate change, is the heating of our surroundings. And in particular in cities, often what we see is that the city center is 4 or 5 degrees hotter than surrounding areas, but leads also to problems. I mean, also for people with respiratory health, with mental health problems, but also for premature mortality. In a study over the last year, we estimated in 100 cities that if we would increase tree cover from the current 15% in the 100 cities to 30% as a target, we could reduce the urban heat island effect by about 1.3 degrees and prevent 1/3 of the premature death related to urban heat island effects. Overall, we estimated that 4% of summer mortality in those cities was attributable to urban heat island effect. So it's quite a large effect, what you get, and also what you could reduce by increasing tree cover. But it's not only when you talk about premature mortality, but also, for example, mental health. This is Barcelona, the example area in Barcelona, and this is what we call the Ejes Verdes, the green corridors that were being implemented, where they reduce, so there's a kind of low caffeine version of the superblocks, where they introduce pedestrianized streets and more green in some streets around the neighborhood. Here you can see some of the changes that were taking place. So left top corner is what was before, and then the others illustrate what it's after, actually. So you see a much nicer walkable neighborhood with more green space and fewer cars around. We estimated that if those would be implemented throughout the whole of Barcelona, we could prevent over 30,000 cases of poor perceived mental health, 10,000 cases that use sedatives or tranquilizers, more than 13,000 cases that use antidepressants, and reduce the visits to mental health specialists by about 17,000. What works around about 10 to 14% of those cases. So you can see that increasing the green space also has an important health effects, in this case, mental health for this. I think, and that was also an article in the Guardian what Gary Fuller wrote as part of his pollution column, is that we need to put health at the center of urban planning. I mean, and that we, should participate in urban planning. In particular, professionals, patients go to urban planning committees or transport planning committees, because urban planning, transport planning has such a large impact on health that we should make it and change it towards promoting health. The problem, I think, is also, that's a quote from this article, is that we don't have a good vision what our cities should look like in terms of health, and that's what we need to be working on. And too often we hear, things like the low traffic neighborhoods, we can't drive our car anymore, and or the low emission zone, it's just to get some money. But these measures are improving health, so we need to make much clearer what are the health benefits of those, and it's not only just a punishment to the citizens that want to drive around. So we need to create a vision of a more sustainable, livable and healthy city so that people can aspire to. Of course, we need to work together with many different sectors and organizations. I mean, I'm coming from a public health background. I mean, I can't make changes, so that's why I need to work together with urban planners, with transport planners, to make this changes possible and create healthier environments. Also, for example, with the education sector, I mean, too many kids are being taken to school by car. I mean, while they should be walking, cycling, or take public transport. And it sometimes is a nightmare how many cars end up in front of the school during the morning hours and evening hours, what creates a lot of air pollution, but also an unsafe environment. Can changes be made? Yes, I believe so. I'll just show you a couple of examples to finish off with. This is Seoul on the left side. I had a big motorway before. They changed it, torn down the motorway, and then they made a nice river area with a small road next to it, a much nicer environment to be in. Even in car-friendly Germany, they got rid of their cars in Düsseldorf and made a nice what is Düsseldorf? It's a lake area, I guess, along the water, where it's much nicer to be around, much more green space, more people walking, much nicer. Amsterdam was not always a cycling city. Most people think that the Dutch have always been cycling. No, if you look in the 1970s, it was car-dominated, a lot of air pollution. Over 50 years, they achieved that there are very few cars and lots of cyclists, much less air pollution in the city. This is a hospital in Liverpool, a children's hospital. On the left side is the old hospital with a park next to it. They needed to build a new hospital. They asked the children, what would you like? They said, we want more park space. So they built a new hospital under the old park with green on top, and the old hospital became a park. So that's how you create more green space that people can enjoy. I also follow the Fiets professor, or the cycling professor, on Instagram, who has always very nice examples of changes. This is from Paris on the top, where you can see a street where the cars were parked. They took the parking out and put in green space. And it looks like a much nicer environment actually to be in. And so you can see this kind of areas actually can be transformed even in our larger cities. This is Vauban again. I just had it before as well. And this is in Barcelona. This is one of my favorite streets. It's the Rambla de Poblenou. There's also a pedestrian street with lots of trees, very pleasant to walk around in the summer. Cycling lanes on the side. But this is also an area where people live, where there are many restaurants and where there are many shops. So you get everything together, a kind of 15-minute neighborhood where you can get whatever you want, actually, and a very pleasant place to be around. And finally, I haven't spoken much about climate crisis, but I recently did a talk and wrote a paper for The Lancet around the topic of climate crisis, cities and health. And I invite you to watch the video on YouTube and also read the paper. I mean, that's available, where there are some more examples, more recent examples, what I actually used. Finally, I talk. This is the team that does a lot of the work, and I would like to thank all of them. Here we were celebrating just the paper that we published, and they are working so hard for the next results and to improve our cities. Thank you so much. It's my email if you have any questions or would like to see any of the material here, or visit our website. Thank you so much.
Excellent, Mark. Thank you very much for this very insightful presentation into our cities and how they shape our health. That I think makes us all think more about where we live and how we move. We have few questions. Let's dig into those before we have a survey to see how you move in your cities and what transportation you use. A few excellent questions. The first one is from anonymous attendee. What are the best ways to tackle false information about 15-minute cities and low traffic neighborhoods? I think this is really something that makes us think. From your presentation, of course, we all want to live in the cities with green, a lot of biking, but why is it so hard to implement these things when it seems that it's so intuitive that most people want to live in places like that? So false information, I guess, is one barrier.
Yeah, no, I think one that is the problem that we come across quite a lot, and it's generally a very vocal minority that are against these kind of things, and they start spreading myths around. I mean, I mentioned in the low traffic neighborhood, the typical, thing what you hear is if you introduce this low traffic neighborhood, you get a lot of traffic around it. Actually, that's not happening. That's what we showed. So we need to create much more awareness, what actually the research says, the science says about this kind of things, and also emphasize, the health aspect. Too often people think it's just to pester them, to get some money from them, or to stop them driving. No, it's about health. So we need to put this this message more out there, and also in particular emphasizing, because a lot of people say, but I don't feel the air pollution so much. But then you have to think about people with asthma, with lung diseases. I mean, they suffer, they're much more susceptible to this kind of things. So we need to bring them to the foreground and let them talk and say how much that improves the situation for them. We did a paper on this recently where we looked also at the language that were used as a result of the low traffic neighborhoods in London. I mean, and you know, the kind of also language that they use, we need to provide different language, put different narrative together against what is going around. But it's a lot of work, eh? And also I say it's a minor vocal minorities, yeah, but still they make a lot of noise, in particular in social media. Personally, I'm not very good at social media, but we should do more and create an alternative vision why they're actually good.
Good points, Mark. Thank you. Maybe we have time for 2 more questions from the audience. So Federico Cusotto is asking, why does the cycling mode share seem to hit a wall at 25%, where further increases in cycling infrastructure seem to provide no additional benefit?
Probably it's because this is an observational study, and there you see the very importance of the cycling lane when there is not much cycling around. Then you can go up, but then beyond that, there's other factors. In this case, we only looked at the availability of cycling lane infrastructure. Probably if we would look at other policies that promote cycling, then you may see more, you could explain more why cycling goes up. Some of the cities that have more cycling are Dutch cities. So there are many other policies. Here we only explain the importance of cycling infrastructure. But of course, these policy measures never come alone. There are normally a lot of different ones. It's whole packages. But as part of this paper, we couldn't explain or we couldn't look into this. And there was a big discussion, by the way, when we writing this paper, if we should publish this or not, because we only focused on one factor. And I believed, yes, let's show the importance of segregated safe cycling lanes, but also, you know, mention in the paper that there are many other policies that are important as well.
All right, great. And the last question, let us see. What is the easiest method to define air pollution related deaths, especially in low resource setting? Okay, this is a little bit different, but maybe to some of those estimates you showed on the preventable deaths or air pollution related deaths in the cities.
I don't understand the question.
What is the easiest method to define air pollution related deaths, especially in low resource setting?
I mean, to look at how many deaths are attributable to air pollution?
I suppose so.
Well, the WHO, World Health Organization, they've got a tool called AirQ Plus, and that's a very easy tool to use where you can put in an air pollution level that you have and air pollution where you would level where you would like to go to, then give some numbers on background mortality, and then you can estimate how many deaths are attributable to air pollution in your area. It's a fairly simple tool to use, I mean, but it gives very good indication.
All right, there was a number of questions in support of what you talked about. How do we get message out there about success of low traffic neighborhoods, especially in London? A lot of people resistant, but then later they like it. Another, Helen Wood makes a point that I don't think you need to convince this audience, but how do we convince people who are resistant to traffic control measures? So some of the repeating themes. So I guess we all need to be more vocal on these issues. Another question, stricter EU air quality guidelines can push these transformations to improve the respiratory health of citizens. Advocacy by medical respiratory societies and patient organizations can make important contribution to such changes. How can we work better together? I think this is all that this is about.
This, in particular, the new legislation that's coming in is very important, and very cities, they react to legislation. They need to do something, otherwise they get punished now. And so I think this is the new legislation that was introduced last autumn. I think it's one of the biggest public health interventions. People don't realize, but it is for a generation. Also, I would like to emphasize it's very important because we know that urban planning, transport planning has such a large impact, but every city has some committees, some traffic planning or some urban planning. But often, you know, these are kind of full of urban planners or transport planners. Transport planners think from how do I get the person as fast as possible from A to B, not from what is the healthiest way to get from A to B. So that's very important why just normal people or people from the medical profession actually also going to sit on those committees to emphasize the health impacts, because often they're not taken into account. They're just not visible. And so that's why we need to make a much larger effort to actually be on those committees. The same for school. I mean, I know there are probably quite a few parents around the school councils, and they should promote that the kids are not being taken to school by car. I mean, let them get on the bike. I mean, much better, much healthier for them. Of course, I mean, parents will say, oh, but it's too dangerous to go by bicycle because there are so many cars. Yes, of course, if you go by car to school, I mean, then you create traffic. So get out of your car, make the road safe. I mean, and that's what we need to do much more. I mean, here we're an audience, a health audience. We think that health is important. As soon as you step outside our bubble, it is not. And that's why we need to, you know, make our voice much clearer and have much more input for drivers of and determinants of health.
Great, Mark. So more health into urban planning into cities. Get all engaged.
Get all engaged, spread the word, get on your social media.
Yes. And final question, I'll allow, extra minute. Again, something that's so intuitive to us, of course, we should have more green in the cities. Everybody would be happier. We would mitigate climate change effects, you have more shade. But what do you see as the greatest barriers to increasing green space, and how can we overcome that?
First of all, of course, it's costing. Also, making other changes. It's quite costly. You need to have the city councils need to have the money to do this. Then also, when you plant tree, half the trees will actually die within a year or 2 years. So you need maintenance. You need the replanting. It's not so easy. Also, like, for example, a city like Barcelona, we've got drought measures, so we're not allowed to plant trees because they need water. So that's another thing. But then also the other thing is that if you want to plant trees, for example, in certain streets, there's a lot of tubes, etc., under the streets. And so you can't just plant a tree or green. So you need to think about that. I mean, and that takes quite a lot of work. But again, I mean, it's raising about awareness, the importance of green space, how much nicer our cities would look like, you know, when you put more green in. I mean, I showed you the picture from the cycling professor in Paris. You know, what do you want? A street full of cars parked, or you want to have a street with nice green space? And so you need to show this kind of pictures. What is currently, what could it be? Or what was it before or what after? You know, to get people's imagination. Generally, people are conservative. People don't want change. Only afterwards, after you made the changes, they will say, why didn't you do that before? You know, that's the typical reaction you get. Why didn't you do that earlier? Why didn't you pedestrianize the street earlier? Because it's so much nicer. And that's what we hear all the time.
Now we need more visionary leaders to just make these changes, because we will be happy for them.
Yeah, right? And showing examples where things have changed. I mean, please take photos. If you live in a neighborhood where they make changes, take photos before and after. Talk about it, you know, go out. I mean, say what the changes are like. I mean,
yes. Well, thank you, Mark. I think we'll close then your excellent session. You really set the stage for us to think about how can we all help contribute for our cities to be healthier and nicer, more pleasant to live. And with that, we'll turn back to our listeners and ask them to see how they contribute to this in their everyday, and to ask a poll. Catherine, if you can launch the poll on what transportation do you use in the cities where you live? Just to get a feeling of our audience. Can we get the poll, Catherine? Yes, so what is your primary mode of transport? You can only make one single choice here, although you may be using several. So please focus on the primary one. And how do you heat your house? Just to get some idea on your contribution to air pollution. And how do you cook? What do you use to cook? So just to get some feeling, and we're well aware that you may be living in a cities where a lot of options, and some there are not many options. But this is just to get some background and to inspire more our thought of how can we make a change perhaps in our choices, if we can, or push our cities to give us more options. Okay, we'll have a few more seconds for this, see results, and then I will give the word over to Phil. Yes, and we have a very nice variety. This is a quite nice share where we have 25% people are biking. This is what we want to accomplish in all cities in Europe, right, Mark? That would be great if this audience is representative entire Europe. So very happy to see that minorities are car users here, and we
I
have
love this
central...
audience.
Yes.
We need more of you.
This should be our goal for all the cities, right? We can just take this poll and excellent. And oh, nobody's wood burning in the house is primary source of heating, and cooking also. We have some gas cooking. Okay, but we'll deal with that. All right. Thank you very much. I'll close this poll, and we'll move on to video. But I'll introduce Phil to introduce our next part of the program. Thank you, Mark, again. And Phil, word is yours.
Thank you, Zorana, and thank you to Mark from me as well. I really enjoyed that. I noticed somebody in the chat saying the presentation was gold, so you can kind of take that as a recommendation. And just to repeat for people who want to know more about it, this whole thing is being recorded, and so the ELF YouTube channel and the ERS Respiratory channel after the event will contain all the presentations, so you'll be able to get hold of them if you want to after the event. So we move on to a focus on outdoor air pollution and specifically how it affects the health of children. Again, once the last speaker, we've got a couple of speakers here, but once the last speakers are presented, there'll be time for the question and answer session at the end. So please do the same thing by putting your questions in the Q&A box. Firstly, we're going to watch a video of Mary Filopoulou, I hope I said that right, Mary, and her mother Marta. And together they're going to talk about living in the city of Athens. So Mary is 16, is currently a high school student who's passionate about raising awareness on sustainability and protecting the environment. At an early age, she was diagnosed with severe asthma and has been living with symptoms her entire life. So let's, and it says on the screen, she's part of the ELF youth group as well. So can somebody start the video, please?
Hello everyone, my name is Mary Filopoulou. I'm an ELF member of the ELF youth group.
And I am Marta. I'm Mary's mother, and we're here today to talk to you about Mary's disease of severe asthma.
Living with severe asthma has been always part of my life for as long as I can remember. And I grew up in a city and the air often feels heavy, which makes breathing even harder for me. My family is always careful to make sure I'm okay, and we carry my inhaler everywhere. And we also check air quality before we go outside. Asthma attacks are really scary. It worries my parents when they hear me wheezing or coughing. Even though I've learned to manage it, it still feels like a really big part of my life every single day. In my area, Seboia, the air quality index is 69, which falls under the unhealthy for sensitive groups category. This means that the air quality may pose a health concern for people with respiratory diseases such as children and the elderly. Asthma has made socializing a bit harder for me. For example, I can't always go to the same places as my friends, like parks with a lot of pollution, and I've missed out on things like joining sport teams due to asthma attacks that cannot cure. It's also hard for me to socialize because I feel self-conscious about using my inhaler or explaining why can't I join in certain activities. And I also worry that people might get annoyed or think that I'm burdened when I have to stop or rest. Even though I have supportive friends, I still feel different and awkward sometimes, but I've worked hard to find hobbies and ways to connect with others that don't make my asthma worse.
Having a child with a severe asthma have a significant impact on my work life because the layers of complexity and stress. That means that we have very frequent doctor visits. We have visits to the emergency departments. We have unplanned school pickups due to the asthma attacks. My constant worry about my child was that I have to be very focused to her caregiving, and sometimes that leads to a burning out.
Factors contributing to asthma in urban areas are air pollution, such as vehicle emissions, industrial pollutants, allergens such as pollen, mold in urban settings, and indoor pollution like smoke and cleaning agents. Firstly, they can collaborate with representatives. They can engage with patient associations, get involved in actions and raise awareness about the needs of asthmatic patients. They can also participate in city planning. They can encourage youth involvement in the city planning meetings to voice concerns. It can also happen with advocacy for clean air policies that can limit emissions from vehicles and factories. And also, public awareness campaigns are really important nowadays, since that they can create campaigns to educate the community on air quality and the importance of clean air for our health. I really dream about being able to go outside and enjoy things like sports or simply hanging out with friends without having to think twice about my asthma. Personally, would tell policymakers to take air pollution more seriously, especially in cities, since it's not just an inconvenience, it's a health risk. People like me suffer every day because of pollution and it needs to be addressed. And cleaner air should be a priority for everyone's well-being. Thank you all for your attention.
Okay, thank you very much to Mary and to Marta for sharing your personal story. It's really important to have all the facts and figures and the science, but you shouldn't underestimate the power of personal stories as well in making an impact on policy. Marta is actually with us today in the conference, so if anybody have any questions for her, again, please put them in the Q&A box and we'll come back to them later. But before we go on to the Q&A, we're going to move on to another presentation from an academic, Professor Ulrike Gehring. Ulrike is the chair of the European Respiratory Society Environment and Health Committee, and she's also an associate professor at the Institute for Risk Assessment Sciences at the University of Utrecht in the Netherlands. Ulrike, it's over to you.
Thank you, Phil. Could you stop sharing your screen and then I will share mine? Thanks. Okay, yes. So welcome everybody. I would like to add the scientific perspective to Martha's and her mother's very personal story on the impact on air pollution on asthma of children. I will start with a more general perspective and then zoom in on children's respiratory health. So Mark already mentioned in his talk particulate matter, and I thought I show you a picture of what it is that we are talking about when we talk about fine particle particles. These are tiny particles invisible to the eye, of different sizes and from different sources with different composition. Well, and some of these particles are small enough to penetrate into our lungs, and the smaller the particles, the more deeply they can penetrate into the lungs, and some of them, the smallest ones, which we call ultrafine particle, can actually translocate from the lungs through the bloodstream to other organs. And these particles, they cause inflammation in the lungs, but also elsewhere in our bodies, and they can cause organ, tissue, and cell damage, which leads to the onset of different diseases. And with the first part, I want to explain a bit more why air pollution is the most important environmental risk factor to health globally and also in Europe. And this is on the one side because although the lung is the primary entry of lung air pollution to our bodies, the effects are not limited to our lungs. Well, we have effects on the lungs, the cardiovascular system, but also on the neurological system and on cardiometabolic health outcomes. And when we zoom in on the respiratory effects for a minute, then the effects are threefold. Long-term exposure can actually cause the onset of diseases like asthma, COPD, or lung cancer. Short-term increased exposures can exacerbate existing lung diseases, and people with an existing lung disease are more susceptible to the effects of air pollution, also more likely to develop other diseases in response to air pollution exposure. So the multitude of organ systems involved is one of the reasons why the health impact of air pollution is so huge. Another reason is that we know there's an increasing body of evidence showing that there is no safe level below which no health effects occur. And these are two figures from a large European multi-cohort exercise where we studied the relationship between all-cause mortality and fine particulate matter, that's the left panel, and nitrogen dioxide, which is an indicator of traffic-related air pollution on the right, in the right panel, and where we see that effects go down to the lowest observed concentrations, and where the exposure response function may even be cheaper at lower levels than at higher levels of air pollution exposure. So this makes that air pollution ranks among the top 10 risk factors for health in Europe. And this is a picture from the globe produced by the Global Burden of Disease Initiative. Health impacts are presented as DALIs, which is a combined measure of the impact on mortality and morbidity. So everybody is, although you may not notice air pollution effects, everybody is affected in some way. And there are some groups that are more susceptible than others. And children, which are the focus of this talk, are one of these groups. And I will go into more detail in a minute. But then there are other groups, and these are patient groups, as we heard from Mary's story. If you have an existing disease, you are more susceptible, you have more complaints in response to air pollution. And the elderly, which have a compromised health. So why are children more susceptible to air pollution? So there are a couple of reasons, and one has to do with the fact that their immune system is immature and their organs are still developing. And the other reason that they have a relatively higher exposure compared to an adult person, because they have different breathing patterns, they are more physically active, and they spend more time outdoors, which means they breathe relatively higher levels of air pollution in relation to the body weight than an adult person. So I briefly mentioned already that the health effects of air pollution can be both on the short term and on the long term, acute and chronic effects, as we call them. I want to first dive in a bit into the short-term effects before I go to the long-term effects. And this pyramid of short-term effects of air pollution does not only apply to respiratory health outcomes, it relates to all health effects of air pollution. And what it shows is that most of us don't experience complaints on days with higher levels of air pollution. Day-to-day variability in air pollution levels driven by mainly weather conditions. But there is a group that is more susceptible, and they may experience more symptoms, may need more medication on days with higher levels of air pollution, will need medical care, hospital admissions, and in the very worst case, this may lead to a premature death. So looking at a few more specific examples on how air pollution affects the children's lungs on the short term, and this is from a study from California where they looked at respiratory symptoms, medication use, school absenteeism, and lung function in children, and where they related symptoms or outcomes to the air pollution levels on the 5 days before the symptom recording. And they looked at fine particles, PM2.5, and nitrogen dioxide. And what they showed very much confirms what Mary told, that children experience more wheezing, more nighttime asthma on days or after days with higher levels of air pollution. They are more likely to miss school, and on average, they have a decrease in lung function levels, FEV1, on days with higher levels of air pollution. So this is about NO2 and PM2.5. Ultrafine particles are hypothesized to be more hazardous than the larger particles because of the fact that they can more deeply penetrate into our lungs, but they are at least currently understudied because it's more difficult to measure them, and they are not routinely monitored. But there's a very recent study that looked at ultrafine particles in relation to respiratory health of children in the Netherlands. And they looked at ultrafine particles from aircraft, which hasn't been mentioned, I think, so far as another source of air pollution, and non-aircraft sources. And what they showed is that children that on or higher levels of ultrafine particles from both aircraft and non-aircraft sources are associated with a higher use of bronchodilators and a higher risk of wheezing in these kids. So NO2, PM2.5, but probably also ultrafine particles play a role in the short-term effects on respiratory health. And in some cases, the air pollution effects are much more severe than symptoms and increased medication use. And I wanted to bring this example of the girl, Ella Kissy Deborah, who lived in London and had severe asthma and died at the young age of 9 years. And this case has raised a lot of attention because for the first time ever, as we know, the corona has noted air pollution as a cause of death of this very young girl. So giving the mortality in relation to air pollution, the severe effects a face, making the science more personal with this story. I now want to switch from the short-term effects to the long-term effects. And I want to focus on the question how air pollution exposure affects asthma development and lung function across the life course, and in particular in children. And this is something that we study in so-called cohort studies. And cohorts or birth cohort means that we ask thousands of pregnant women or parents of young kids to participate in our studies, and we follow them through their life. Many of our cohorts have studied participants into young adulthood. And then we study whether those with a higher air pollution exposure, for example, have a higher risk of developing asthma or have a poor lung function growth. And I decided to focus on asthma in these examples because it's the most common communicable disease in children. Millions of people are affected, and as we heard from Mary and her mother, it's a real burden to patients, but also their families, and it restricts their lives to a large extent. The other outcome that I will focus on is lung function growth, or the FEV1, the forced expiratory volume in 1 second, and this is because it's a strong predictor of COPD. In this picture, you see how our lung or the FEV1 grows during childhood into adolescence, reaches the maximum level at young adulthood, and then when we get older, lung function decreases. And COPD has always been considered to be a disease of the elderly associated with a fast decline, as presented with the red line. But there's growing evidence that about half of the COPD patients had a poor lung function growth in childhood, indicated by the black line. So what happens in childhood has long-term consequences for the rest of our lives. So what do we know about the relationship between long-term exposure to air pollution and childhood asthma? And this is a summary from a review article, and especially air pollution from traffic like NO2 is associated with a higher risk of developing asthma in childhood. And this is from the cohort studies, as I just explained, that follow children to different ages up to the age of 20. So we have this risk estimate or the odds ratio from these studies, and that can be used to do a health impact assessment. This is what Mark explained in his study. And we can translate that into or estimate the number of new asthma cases worldwide from this epidemiological evidence on the size of the effects. And it has been estimated that about 4 billion new asthma cases yearly, or 13% of the incidence of global asthma, can be attributed to NO2 air pollution exposure. And then when we look at lung function, what we know that this is just one example, a study from the Netherlands that I was involved in, but there are more that show that air pollution, including NO2, but also particulate matter, is associated with a lower lung function growth, leading to a suboptimal lung function plateau in young adulthood. So these are the studies showing the adverse effects of air pollution, but there's also a growing number of studies that show the benefits of reduced levels of air pollution, which may actually strengthen the argument for a causal relationship in the need to lower air pollution concentrations. So this is a study from Sweden where air pollution concentrations are relatively low when we look at Europe. And this is a birth cohort of about 4,000 children. And what you see in the upper panel are 5 different trajectories of air pollution. What you see is that in all 5 groups, air pollution decreased over the first years. And then at some point, there are different trajectories, with the purple one having a steeper decrease than the others, and the blue one having hardly any decrease in NO2 concentrations, for instance. And then the researchers, they looked at to what extent the asthma risk was different in children that had these different trajectories of exposure in the first years of life. And they found that the risk of asthma was about half in group 5, with the lowest exposures compared to the group that had basically no decrease in air pollution levels. So this demonstrates that if we reduce air pollution level, that can have a huge impact on asthma development, or even in settings with very relatively low air pollution concentrations. The same group did the same analysis, but then with lung function as the outcome parameter, and they showed, and I indicated that by the red box, they found that those kids with a steeper decline in air pollution levels and a lower exposure in early childhood had on average, a better lung function growth than those that were exposed to higher levels throughout childhood. So these studies on the adverse effects, but also on the benefits of reduced air quality, are important. And this is only part of the evidence. And the WHO reviewed all the evidence on air pollution and health effects in their 2021 revision of the air quality guidelines. And they argued with what we know now, we can say that above the levels depicted in this table, the 5 micrograms per meter cube for PM2.5 and 10 for NO2, serious health effects occur beyond any doubt. So we need to work on to put more pressure on policies to reduce air pollution to these recommended levels. The new EU limit values that I show there, and I also added the old ones, are a good step forward, but we need to work harder and to make sure that we go down to the WHO recommended limit values. And the map on the right-hand side shows that basically all of us will benefit from further reductions down to the WHO limits, as only very few, about 2% of the European population currently is exposed to levels within these limit values. So to summarize, I hope I could show you that air pollution is causes a very large burden of disease. It affects everyone, but children and respiratory patients are especially vulnerable. It's important that we have ambitious policies and aim to reach the WHO air quality limit values. And what I haven't talked about here, but what is maybe also important, the reduction in air pollution health effects does not only come with benefits for health, but also co-benefits for climate, economy, and quality of life. Thank you.
Thank you, Ulrika. Very interesting presentation. We fortunately now and we're keeping on time as well, so we have plenty of time for questions. There's a couple of questions appeared so far in the Q&A, which I'll read out in a minute. But people can still add more, and we'll come to them because we've got about 10 minutes left. First question is actually for Mary, or for Marta, who I believe is with us, from Giovanni Vieghi. He says, does Mary experience any health benefit when she moves out of Athens for vacations? Marta,
Hello,
can you answer that?
Hello, can you hear me well?
Yes, we can hear you. Thank you. Yeah.
Thank you. So happy to be with you. Mary, of course, you couldn't be here because he's at school, so
Sure.
I have to answer some questions. You realize that, yes, every time we have to go outside Athens where we are going for vacation, we are very careful and we are very careful where we are going to, if it will be a pediatric section around, if it will be a hospital or someone expert in the respiratory, but childhood respiratory system, so we'll be more safe. Always we measure and we look after the values of the pollution that may be in this section. And of course, every time we have a very good organized plan of medication with us, so nothing will go wrong.
Okay, thank you. Next question from Miguel Haas. This is about indoor air pollution, which I believe is probably going to be the subject of a whole conference to itself later on, but we'll ask the question now because Ulrika may have something to say. She says, I believe that it's important to put more emphasis also on exposure to indoor air pollutants, including secondhand smoke, dust mite mitigation, and pollen avoidance. How can we increase information about it for everybody?
This sounds, yeah, please
go. Okay, so yeah, this is definitely a different topic, a huge topic, and outdoor air pollution is an important determinant for indoor air quality because it penetrates into our home, but it's not the only source. So there are also studies that looked at specific sources of indoor air pollution, like gas cooking, and also their relationships with especially asthma in children have been found. So there's a good evidence for that, and there are also studies looking at the relationship between smoking, passive smoking, and childhood asthma, and that there have also adverse effects been observed. And then there's a whole story about allergens and microbial exposures, which may probably go too far for this, but there's definitely evidence out there for other sources of air pollution and specific allergens being important for respiratory health.
Thank you. Marta, do you have any comments on that? Because Maria mentioned the indoor pollution in her video as well.
I just say my daughter's work that she is working so hard for secondhand smoking, and she believes that no level of exposure can be because it's so harmful for the respiratory system of the children. And I believe that it's not only an utopia that we have to talk about it. We have to talk about very clean air And of course, when we are talking about smoking, we have to include all tobacco products with no exceptions. And I believe in a couple of years, we may say some very different, and we have to give very powerful messages to the world from the adolescents' points of view.
Yeah, thank you. Okay, I saw a third question, but it seems to have gone off the list now. So anybody in the background knows about that, they can try and find it again. But in the meantime, one thing that occurred to me for everybody, I suppose, really, is that Mark talked a lot about the kind of the premature mortality, but Ulrika talked more about kind of actual kind of health impact across our whole life course. And it strikes me that in the UK particularly, politicians are going to be more motivated to make changes by by kind of health across the life course because of the impact on health systems and hospital admissions and so on. So where would you think the balance lies between kind of making the point that this kills people or this just makes people more unhealthy and therefore is a burden on public services?
Well, I think, well, we're talking also to policymakers in some of our projects. I also realized that talking about respiratory health is usually, they find that a much more convincing argument than the preterm mortality. And this is probably also because people may think that it affects, or they may lose the last month of their life and they don't care because life expectancy increased a lot. While they forget about the trajectory that actually comes first and results in preterm mortality, and that's a large burden of disease. And then I think talking about healthcare system costs over preterm mortality. Yeah, I can imagine in the national context, if we have to, well, decide where we spend our money, the healthcare costs, and which are larger for morbidity may be a better argument, but I think that depends on your specific audience where you feel, well, whether it's morbidity or mortality costs, cases, what arguments works best. That's my experience.
Yeah. Okay, so there are a couple more questions now. So what can an anonymous person says, what can patients do to protect themselves day to day against the risk of air pollution? In other words, what can we do while we're waiting for our great and good to kind of make our cities cleaner?
I think there are a couple of choices in your daily routines or activities. Like, well, there are typical situations in winter where there's little wind and there are high levels of air pollution because it doesn't disperse. So you could restrict your outdoor activities on these days. I acknowledge this is maybe a limitation in your daily activities, may help to decrease the symptoms if you stay inside at situations with poor air quality. A lot of countries have daily monitoring systems that can give you some information on what the air quality is on a specific day. The other thing is you can plan activities, for example, outside of rush hours if you move around the city. Traffic-related air pollution will be higher early in the morning and late in the afternoon. But if you, for instance, exercise or go for a walk outside of these peak air pollution hours, that could help a lot. And the other thing is, if things get really, really bad, and you are in the lucky situation that you could move to another location, then moving from, if you live close to a high, busy traffic street to a more quiet location with less traffic might be an option. But I acknowledge this is definitely not the solution to the problem, and not something that we would want to recommend. So it's on the policy level where things need to happen for all of us.
Okay, thank you.
May I add something?
Yes, of course, Marta, go ahead.
Yeah, thank you. Another thing that I think that patient can do, first of all, can share their thoughts. They should communicate with others. They should have an interactive dialogue with all the policymakers, of course, with patients' foundations and groups. And of course, now because we have the power of the social media, they can talk very loud, and of course, they can make decisions or they can have outdoors activities that they can create very powerful and helpful messages. And I think there will be a plus if we work all together to that.
Thank you. Then probably got time for this because a couple of questions on the similar theme about how to engage healthcare practitioners. One's asking how can we do that? How can we engage health practitioners on air pollution? And then somebody else asking how can we improve care for patients with severe reactions to air pollution? The feeling that some doctors seem to think it's somebody else's problem. They get involved in it. Do you have any comments on that?
Maybe on the first one, on how to involve healthcare professionals, I think what we can do, at least as scientists and as European Respiratory Society, is increase the awareness. So provide training material, information to practitioners to make them aware. I think many of them may also not be aware of the consequences of air pollution and the impact on their patients' health. So I think that would be from the scientific and society perspective be one thing that we could do.
And I suppose the second question goes into a bit more detail, saying that this is a discussion these have, or the person's had with their doctor, but not been able to find a medication solution yet because you can't avoid bad air quality. I think you've already talked about that in some sense about what you can do to kind of minimize it a bit, but I guess the question is we're a bit stuck with it, healthcare practitioners and patients, until the policymakers do something.
Yeah, and of course we can all contribute by changing our lifestyle. I mean, it may seem a small contribution, but if we don't use our cars, that very much combines links to the talk of Mark. We can change our daily routines and try to be less car dependent and choose for active travel more often. But we can also raise our voices and make a case for air pollution and health effects. Any kind of wood burning, for instance, is an important source of air pollution. Not burning wood, or doing that at least only on days where the weather circumstances are in a way that it disperses and it doesn't stick to the ground and increase people's exposure. Could be a way to change our own behavior. And if we all do that, all the little bits together, that can of course also make a difference.
Yes, so, yeah. And we're going to be talking about wood burning in a couple of minutes, so that's a good lead into that. There's one question I haven't actually asked. This is on a similar theme to what we talked about before, but I'll ask it anyway. What can we do to minimize the aspects of air pollution in children to try to give them a better chance of healthy lung development? And I assume that means us as people, because Mark talked about the kind of the policy and city level changes that are needed. But is there anything we can do as our neighbours, parents, grandparents?
Well, I think much of what we breathe is determined by the place where we spend our time, so where we live. So having residential neighborhoods not close to busy roads would be an important step, given the role of traffic. But then the other place where children spend a lot of time is at school. So also schools should be located at places away from busy roads, and schools could put in place policies that make it impossible to, if I bike past the school in my neighborhood, in the morning I see all these parents bringing their kids, even in the Netherlands, people do that, bring their kids by car. Mm-hmm. So if you have a policy that doesn't allow all these parents come close to the schools with their cars, that could also be a way to reduce children's air pollution exposure.
Mm. So that's something that parents can maybe activate for in their own schools. Because
we also can defend our rights and we can fight for our rights for a free and very wealthy environment, because it's the right of our lives and our children's lives. It's very important also.
Indeed. So thank you both again. There aren't any more questions in the Q&A, but that's probably a good note to end on, Martha. Thank you very much for that. Thank you both, and thanks for Maria as well. Please pass on your thanks to our thanks to your daughter for us. And then I'm going to hand back to Zorana for the next session.
Thank you, Phil, and thank you for all the speakers. We have, from talking about cities, moved to health effects of air pollution, especially focused on children and especially the most vulnerable group, asthmatic patients. And now we're going to move on to talk a little bit more about another very important source of air pollution in our cities and outside cities, and that is wood burning. If you remember the Mark's slide, which was mostly his talk about urban planning, which always is mostly focusing on traffic, and traffic contribution to air pollution and health has been perhaps most studied and understood. But wood burning and residential wood burning especially is also a very significant source of PM in the cities, and something that has not been talked so much and tackled so much perhaps in research, but we need to raise awareness, and that's what we want to do with the next speaker. It's my great pleasure to introduce Kåre Prask Christensen, who holds a master's degree in environmental engineering and PhD. He has been teaching air pollution at Technical University in Denmark for 20 years. Kåre is also an expert in environmental issues as a part both of indoor and outdoor air pollution, as a senior advisor on air quality and half-time work in 2 nonprofit NGOs, Green Global Future and Healthy Indoor Environment. And he has great expertise to talk about next topic, and also some measurements that his team has done to really can shed some more light on really how much wood burning also contributes to air quality in the cities. Kåre, if you can hear us, please share your screen and your slides.
I will try to share in a second. Let's see if I succeed.
And again, please post your questions in Q&A box, and we'll have a Q&A section right after the
So, Zorana, do you see my presentation in presentation
I see
mode?
your slide, yes, and we hear you well. So go ahead, floor is yours.
Thank you very much. And just starting to say, this has really been so exciting all morning. And here in Copenhagen, living in a residential area as a father of 4 children, I can say that 95% of all children, they are going to school by bicycle or walking. And the last 5% coming further away from, they take buses and then walk the rest of the way. So this is wonderful. And schools, you cannot drive close to them in the morning. So from 7:30 to 8:15, you're going to go there by car. The small streets around them are blocked for private cars. So this is wonderful. So it is possible, and I think it's possible all over, and it gives good advantage for parents because you don't need to drive your children in the morning. They take care of themselves. But now for the issue impact of wood burning in an urban environment, and let's jump right into it and look at some pictures I took in Slovakia in November month. This is a small city in Slovakia. They burn huge quantities of wood because wood is free. They have gas, but gas is more expensive. The houses have a very poor insulation standard, but it's much cheaper to burn wood than to insulate the homes. And just a few chimneys, they can pollute a complete village in a valley. As we see here, you have lots of inversion, so the air is very still in the wintertime. And it's really terrible for some of these people. Look at this. And this is not clouds. This is just a full valley with houses and homes with children filled up with smoke. Then everybody could say, okay, these are poor people in Slovakia. Well, it's better in Copenhagen where I live, but it's not good. There you have very wealthy people, else they wouldn't be able to afford these houses, but they still burn wood, even though they have access to extremely cheap district heating. They mainly do it to create a cozy atmosphere, but at the same time, they create lots of air pollution. So let's just look at Copenhagen, because there we have very good inventory, really mapping how much wood is burned in how many stoves. So we only have 13,000 wood stoves in Copenhagen, and we are about 660,000 inhabitants. But these 13,000 wood stoves, they emit more toxic fine particulate matter, PM2.5, in a winter than all traffic in the city emits within 1 full year. Even though wood burning only covers 0.3% of the energy consumption in the city, it emits 37% of all PM2.5. Or in other words, if we just replace the 0.3% of energy from wood burning with cheap district heating, then the emission of fine particulate matter in Copenhagen would be reduced by as much as if we banned all traffic in the city 24/7, 365 days a year. So this should be an extremely low-hanging fruit. From a political point of view, it's much more difficult, because wood stoves are in private homes, but traffic is in public streets. If we're going on Europe, wood burning is the dominating source to many key pollutants, both outdoor and indoor. The wood stoves are in our living rooms, so they can emit pollution directly to the air in our homes. I'll return to that. But to say we are mainly talking fine particles, ultrafine particles as well, black carbon, pHs, VOCs, of course carbon monoxide, and then dioxins. And wood smoke, it thereby contains many of the same carcinogenic and health hazardous particles and pHs as tobacco smoke. And then on top of that, it contains dioxins when we are in countries close to the sea. Actually, here in Denmark, more than 50% of the dioxin emission is due to residential wood burning, only covering 3% of the national energy consumption. That's because when you're close to the sea, then wood contains chlorine. When we talk wood smoke, it increases the risk of the same diseases as tobacco smoke. It has already been said, we are talking cardiovascular diseases, cancer, lung disease, and so on. So it contributes significantly both to morbidity and premature mortality and to climate change. Let's not forget that. Black carbon is a super pollutant, both in relation to public health and the climate. Wood burning emits large quantities of methane and, of course, carbon dioxide as well. The reason for this very high pollution, even though wood burning covers a very small percentage of the heat consumption, can be seen here. In red bars, we have the fine particle emission in grams per gigajoule of fuel, and then I've added the black carbon emissions as well. What we see to the left is the new stove fulfilling the new eco-design criteria coming into force in 2022, and then we have the best Nordic stoves carrying the Nordic Swan label, polluting a little less. But then you can see that, well, if we move to district heating or heat pumps, we would almost eliminate the particle emission. And to the far right here, you can see that the emission from trucks in urban driving in 2023. It is very, very small compared to emission from wood stoves. And that is because new trucks, they have a filter. So the key particle emission related to those are from brakes, tires, and asphalt. And the black carbon emissions related a little to some of the exhaust pipe not being removed in the filter and a little to tires. But this clearly shows that even new stoves, they do not solve the problem. And there are huge benefit by switching to district heating or heat pumps. And we can do a small, very simple calculation. If we take a new wood stove fulfilling the eco-design regulation, it emits during optimal lab conditions, this is quite important, but during optimal lab conditions, it emits about 5 grams of fine particulate matter per kilogram wood burned. We know that the new WHO air quality guideline is 5 micrograms. Then we can divide two numbers by each other and see that just burning 1 kilogram of wood in a new stove fulfilling the eco-design criteria will pollute 1 million cubic meters of clean air to the WHO air quality guideline. 1 million. That's all air covering 10,000 square meters up to 100 meters of height. So just burning 1 kilogram in a new wood stove fulfilling the eco-design criteria can pollute a complete neighborhood. And this is, of course, not aligned with the EU zero pollution vision, and it will generate a high pollution in residential areas. When we do emission testing, it was told in the beginning by the chimney sweeps, oh, new stoves carrying the swan maple label, you can't even measure their pollution. And as you see to the left, you don't see the pollution when they are warm and efficient, but we measure the ultrafine particles in particle numbers per cubic centimeter. We go above the maximum detection of the PTRAC, which is 500,000 particles per cubic centimeter. If we compare that to a new truck with a filter, we are typically below 1,000 particles per cubic centimeter. And again, at the moment, there are no filters on stoves. We are fighting to get it in the revision of the Eco-design Directive, but industry is battling us big time. And of course, we can see that when we measure outdoor air pollution, an evening where there's a smell of wood smoke, not a heavy smell, and then a Saturday morning where we have no smoke of or no smell of wood smoke, the same place we have the same low air quality standard. Then if we look upon the costs, because all this air pollution have a huge cost to society, then we have externality values for the key pollutants emitted by heat sources, both for PM2.5, NOx, SO2, and ammonia. And an externality value is meaning how much does this pollution cost per kilogram of emission. And then you can actually multiply this cost value to the emission of gram pollution per gigajoule house heating for different heat sources. And there you see that wood burning, both in stoves and boilers, are much more expensive than all other heat sources. And the costs are divided between costs inside Denmark and costs outside Denmark. So for society, wood burning is definitely the most expensive heat source you can imagine. And if users of wood stoves or wood boilers had to pay the health costs, they would never use wood as a fuel. They would change to other heat sources, especially in urban environments. We see very high indoor air pollution levels as well of ultrafine particles, much higher than we actually see in outdoor air. And that's because some stoves, both new and old stoves, they emit smoke directly to the home, both when you open the door to put in new wood, but as well when the stoves get really hot, the iron expands and then they start leaking. And finally, if there's some dust on surfaces, it is burned when the stoves get really hot, and that is then created or transformed to particulate or particles. Here we have an investigation from 8 Danish homes. We measure, of course, before kindling, then we measure the average over typically 3 hours, and then we measure the maximum half hour average. And what we can see is before kindling, there is quite clean air in the homes, but in many of these homes, the average concentration increased to extremely high levels when they start using the wood stoves. It's the owner of the house using the wood stoves just as they usually do. And of course, they don't smoke or cook food or use candlelights or anything else during the measurements. And the WHO, they introduced a limit for what they call high air pollution. That should, of course, be avoided. And that is on an hourly average 20,000 particles. And that is actually violated if we look upon the maximum half-hour averages and full-hour averages in lots of these homes. The tricky thing is that the homeowners, they cannot smell the smoke. We have asked them, do you smell the smoke? And they don't. So they're not aware of the risk. And as it is now, there are some weak limits, as mentioned, for the outdoor air pollution from wood stoves. But even though they are in our living room, there are no limits of how much they can actually pollute the indoor environment. They can emit just as much smoke to the living room as they want. We are trying to get requirements for indoor air pollution into the Eco-design Directive, but again, the stove industry is very much against. Then just a few words on greenwashing. because in many states, in Denmark and abroad, for decades, the stove industry, they have actually greenwashed stoves, saying they're environmental friendly or climate neutral or even good for the climate. So some years ago, we filed an official complaint to the Danish Consumer Ombudsman about this misleading marketing. And it took our Consumer Ombudsman almost 1.5 years to go into the case and interview lots of experts. And they came out with a clear ruling saying that wood stoves, they emit harmful particles and climate damaging pollution, and they cannot be marketing as environmental friendly, climate neutral, and so on. Of course, the stove industry was extremely angry on this because that was the key marketing argument, but they accepted the ruling. I think this could be done more or less in other states, and I'm happy to share the complaint to our Consumer Ombudsman. We're actually getting it translated this week. And we'll have a webinar a month from now where we'll talk more about national measures to reduce air pollution from residential burning. So what should be done? I think that's the most important. We can talk about all the challenges and we are well aware of them, but what could be done? First of all, we of course need stricter emission limit values and indoor emission limits for new stoves. In the new Ecodesign Directive, we'll have the expert consultancy forum of the European Commission, the 12th of February. I'll be there as an expert, but every time there's one green expert, there's 20 people from the industry, so it's not a fair level playing field. But we have a webinar here next week, and together with Deutsche Umwelthilfe from Germany, we'll try to explain what different organizations or active people can do to help us convince the Commission and national authorities that we should have stricter emission standards and indoor emission limits for new stoves when we have the going revision of the Ecodesign Directive that is going on now and will end next year. Then, of course, we need on a national level laws and financial instruments to promote energy renovation, insulation, and so on. Typically, wood burning in many cities is only an additional heat source, maybe covering 20-25% of the heat. And this can easily be saved by better insulation. Then we need, of course, to promote cleaner heat sources, heat pumps, and district heating. And then we believe we should have a ban on wood burning in the richer parts of Europe. That's definitely possible. We're not Stone Age people anymore. We can avoid this campfire in our living room. But then, of course, we need to respect that there are poor parts of Europe where it will take time before they can do without wood burning, and we should especially insulate these homes to limit the amount of wood burned and give them some subsidies to afford cleaner heat sources as heat pumps. And then again, we need massive information on the health and climate issues on this matter. It has been a little overseen problem. Maybe many politicians have focused on traffic. I've worked a lot on that for decades. So of course we should keep on focusing on that. But actually now we have very efficient particulate filters and catalytic converters on all diesel cars and even gasoline cars with direct injection sold in the European Union. We need to limit the loopholes, I fully agree, but we need to look broader than just traffic. But of course, keep focus on traffic, get much more of the health promoting traffic like bicycling and walking. Then I'm giving a little more information here. First, our homepage, there's lots of information on indoor air pollution from residential wood burning and some of out. And then in the chat, I gave the link to our homepage because there was a question about indoor air pollution. We did lots of investigations on air pollution from candle lights, from food cooking, different kind of particles, particle sizes, and so on, and husk dust mites, and mud, and God knows what. Use it whatever you can, and share it to everybody so we can all get a healthier indoor environment. And also to say that our work on indoor air pollution from residential burning is founded by the European Climate Foundation. So these were the words, and I believe that it's 3 minutes for questions.
All right. Thank you very much, Cora, for this excellent insight in how big wood burning can be of a problem. We'll extend a little bit time for questions and discussions since our next speaker unfortunately could not be with us because she's ill. But since she's coming from Bulgaria, and I think you made a really good point, wood burning contribution to air pollution in Europe is quite a different issue in West and East, in rich countries and poor countries, so to say, where is just a matter of coziness. In Denmark, that's really been the only reason not to do anything about this, since we're a country that has alternative heating sources for most citizens, by far most, that we could easily solve the problem for those that don't. And there is issue of energy poverty and socioeconomic pressures in the countries in the Eastern Europe and Southeastern, where poor families do not have alternatives, and wood and worse things than wood are being burned because of that. That's a pure necessity for survival and managing. So we have really, maybe you want to talk a little bit on those two issues. They're very important and they require different solutions, and also from the top of EU in terms of subsidies to solve this problem. So maybe we can start with that, as I do not, I get overview of Q&A. I think some questions are coming in.
Yeah, I mean, I've worked measuring air pollution both in the poor areas of Hungary, Slovakia, and Czech Republic and Poland. And of course, when you're in the cities, wood burn could be avoided, but in the countryside, they have no other possibilities at the moment. But we need to remember that they are countries in Central Europe. So particles emitted there, it doesn't stay there. It spread around in Europe, actually causing health effects in the rest of Europe. So I think it would actually even make sense to give direct support for other countries to help avoid wood burning in these countries, because even here in Denmark, depending on wind and everything, we will inhale particles from even Slovakia and Hungary because they spread. So I think we need to go really into the European Union to tackle this. And of course, the richer countries should avoid this unnecessary pollution and help the poor countries to get rich enough to avoid it. When I think about if something should be banned, I will think, if we invented this today, would it then be legal? So if nobody was tobacco smoking and we invented tobacco smoking today, would it be legal? Not at all. It would never be legal. It's the same with wood burning. So I think that's always a good argument, at least when we talk to politicians, because they agree on that. Now the problem is just, it's there, somebody's relying on it, and we need to find better solutions for them. And their support is one of the things. And then one thing, being poor is terrible. Being poor and cold is terrible, but being poor and having sick children or being sick yourself, not having the proper treatment is even worse, I think. So they have a motivation to do so as well.
Thank you, Cora. I think as in urban planning, I guess maybe I want to tie this a little bit into the health argument. Another myth, perhaps, that we have seen in health effects of wood burning that's perhaps not as dangerous as traffic, which is absolutely not true, and we know that, and maybe Ulrike can also give us some insights into this. We have studied traffic more and better because we have traffic data. Traffic is something all the cities measure, and this we can translate to good studies on health effects of traffic, and simply we just know much more of traffic. Wood burning is it's much more difficult to measure and map. Even in rich countries, Denmark, we don't know exactly who burns how much wood. This is not regulated. This is not mapped anywhere for us to access this data to link it to health. But particle is a particle. If it comes into your lung, no matter which source, it causes all the effects we've seen in Ulrike. So we just want to get that myth out of the way. It doesn't make healthier because we maybe like wood burning smell and relate it to something, as you say, back to our Viking roots in Denmark, or having a fire burning in a summer camp or something. It is dangerous no matter where it comes from. I don't know, Ulrike, if you want to just confirm that and make that link on the health of wood burning, effects of wood burning.
Yeah, I think, well, there are a few studies looking at wood burning health effects, but usually smaller studies. And that's what you say, Sorana. It's the health, the exposure assessment. While we have pretty good models to model fine particles and NO2 from traffic, we don't have that for wood burning because it's, well, the emissions vary seasonally from day to day, weather plays a big role. And so we simply don't have these large-scale studies, but that we don't have them doesn't mean that the particles are less unhealthy than other particles.
No,
Thank
and
you.
one thing, Joanna, if I may add, is that one of the key arguments when we talk to politicians is really that wood, that's the material of nature. How can it pollute when you burn it? That's really how the politicians are thinking. And then when you remind them about tobacco is a natural plant, and when we burn that, the smoke is toxic. And they agree on that, of course. So they see the link. I think it's just because they consider wood as a natural material and diesel is artificial oil product. So these particles and these pHs must be much more toxic. It's not necessarily like that. And we see it's both olefin, fine, and benzoapiren. And we know that from other sources. Why should benzoapiren in wood smoke be less toxic than benzoapiren in tobacco smoke? It doesn't make sense, at least not in my world. And the size of the particles are the same as tobacco smoke. Diesel particles are a little smaller. That may be why they penetrate deeper into the lungs. Aviation particles are even smaller than diesel particles. So there might be some differences, but in wood smoke we have all particle sizes in high quantities.
Good. So that myth is out. Particles are particles. They shouldn't be in our lungs. Another myth, I think, Cora, that you brought nicely into the discussion, that people that burn, even have newest wood burners, they still pollute their own homes, their indoor environment, their own children, not just the neighbors. It's just going out and it's more polluting than a truck. I think that's also an eye-opener, very important information. Okay, I'll switch to some questions now. They're trickling in.
There's one coming here in the chat actually saying that if you just burn real good dry wood, then it's not as harmful. Well, that's actually a misunderstanding as well. Because when you test the wood stoves in lab, you use really dry wood, you use the optimal stove, the optimal oxygen supply and everything, and that's the figures in diagram. And they show you have extremely high air pollution, and this is confirmed. Of course, it's worse if you burn garbage or if you burn wet wood or you use a really old stove. It's even worse. But even on the best case with the best fuel and the best person using the stove and optimal, it's a disaster. So wood burn is really something we need to get rid of, and we have the climate perspective as well with the CO2 emission. And new wood stoves, we need to take that into account. They emit more soot than old ones because they burn at a higher temperature, mainly.
Thank you, Cora. Okay, a few questions. Let's address them. Jeanette Boyd asks, where can we find resources that inform people on the issues of wood burning? I think you provided a few links related to Denmark, but I hope there are more in the countries where you're from. It seems to be something that is overlooked. We agree on that. Do we need to focus more on education of the health issues? And I think we agreed on that. Maybe a brief comment, Cora.
I think so, really. If you take this general assumption that when we burn wood, it's the material of nature, it doesn't pollute. We said then, for example, many daycare institutions where they have a bonfire. And they go there and they make food over this bonfire, and they are exposed to extremely high levels of particles. I was responsible for the Danish investigation of this. And what is funny is we don't talk about the results with the people working in these daycare institutions because we want to do the data treatment. We don't want any headlines and so on. But on the other hand, when we are there, they go and look what we are doing. And they can see that before the bonfire, they have a very, very low level, and then the pollution gets more than 100 times up. We cannot hide that for them. So, of course, some of them asked me, well, Cora, now the pollution is like 200-300 times higher than before. Is this a problem? I said, well, it's, of course, a quite high level, not to create panic. And he said, oh, yeah, sometimes some of the children sitting around, they get way too much smoke as well. So they need to go indoor and lie for half an hour until they're ready to go again. And this just shows that some of these people working with the children, they actually think about this. We're sitting around a fire, they get ill, they need to stay inside, parking for half an hour before they're going again. But they don't see, they still assume it's okay to have a bonfire because it's just wood. And this is the general misunderstanding. Burning wood creates huge quantities of air pollution just as burning tobacco. And we should avoid this. In third world countries, indoor food cooking with wood is one of the key sources of child mortality and even adult mortality as well. And then now we are adopting it into our daycare institution in the richer part of the world, just due to some Viking gene, as you say. Of course, it creates a cozy atmosphere. I fully agree, but we need to use our logic sense as well. As one of our researchers says from our National Research Institute, well, if we go to our daycare institution and children are sitting around a bonfire, we just smile and says, this is cozy. But if we go to our daycare institution and the people working there gave each of the children a cigarette, and they're sitting smoking, there would be a court case within 5 minutes. And that's just because we don't know any better. If we had been sitting having this meeting 60 years ago, we didn't include tobacco smoking, half of us would be smoking indoor now. None of us would do that now, not only because we are who we are, but everybody could go outside if they are smoking. So we get wiser, but this just takes time, like the information on tobacco smoking.
Thank you, Cora. Giovanni Viegi asks, Cora, how can be avoided that the proposed ban of wood burning in rich cities ends out in increasing social and health inequalities linked to air pollution? Very important question.
In the larger cities, at least in most of the cities I know, when we talk the richer part of Europe, the people living in one-family houses are definitely not the poorest people. It is the richest people. And they can afford the heat sources. So I don't think it ends in social problems. In most of these cities, the poorest people, they live in small apartments and they don't have a stove. So I don't think it goes like that, actually. It goes more the other way around. In the larger cities, in the richer parts of Europe, then you have the poorest parts of Europe, and there we need social support for insulation, for cleaner heat sources, for information as well. And even when we go around with measuring devices, you know, there are mothers, there are people asking what we are doing. And when you talk to mothers there, especially, they are well aware of this is not a good thing. They don't know what else to do. They are living there. But they are concerned. So it's not that these people are stupid in any way. They just don't have any other possibilities. And we need to provide them these possibilities so they can be a healthy society like the rest of Europe.
Okay, thanks, Cora. So thanks, Viegi. So in some of the richer countries, this is also a myth that is the poorest one, the burn word. It's actually the opposite, the rich ones. And of course, completely different issue. Southeastern Europe, where we need strong economic support to provide alternatives to wood burning. Question from UK, from Lisa McNeil. I'm from UK, never heard of district heating. Does anywhere in UK have district heating? Okay, so this is an issue of UK.
It's a good question. I believe there would be some places in UK having district heating, but it's very different. You know, here in Denmark, when you have an electricity plant, just to make it simple, a power plant producing electricity, then you convert about 40 to 45% of the fuel to electricity. The rest becomes heat and is wasted. So here in Denmark, we converted this heat to district heating and use it to heat our buildings, not due to environmental or climate issues in the old days, but because we were a poor country in the old days. So that's what we did. In the 70s and 80s, after the oil crisis, this is what we did. And that makes your efficiency of your power plant, it goes from 40 to 45% to 95%. You save half the fuel. And that was, of course, just because then we saved money. But that could be done all over. In countries where you have had nuclear, this is not quite possible because the temperature is not as high. So you cannot make district heating the same way. But now you can make district heating by huge heat pumps fed in by electricity from clean sources. And the good thing about that is that the wind electricity, the wind varies in production, but then you can save all this in hot water in your district heating system by converting it to heat in a heat pump, typically having an efficiency of a factor 5. So district heating needs to be multiplied, then you can really avoid it, but else heat pumps are a great alternative as well.
Thanks, Cora. And the last questions, this is for Colette Armitage. We should learn from the haze in Southeast Asia. They imprison directors and fine the firms. I'm not sure who is in prison and fine the firm. I guess this is a call for stricter regulation of polluters. I guess for wood burning, I don't know if you want to address that question, Cora. I guess it's more a comment. I want to bring attention to you, Cora. You've mentioned Denmark and greenwashing and misinformation to users, right? I think still Danish wood burners not going to get information that this is dangerous. It's not just as dangerous as diesel truck. I mean, the information you showed us is not something that goes to the people buying wood burners. But at EU level, as I'm aware, there's also something a missing chain, and still wood burning is unfavorably labeled as climate neutral because it's a renewable energy, right? So this is also higher up. Can you comment a little bit on that? What needs to be done in regulation higher up that could trickle down to all countries? And
Of course, what we need to do in the Renewable Energy Directive is actually to address the CO2 emission from wood, especially residential wood burning, because there you burn wood logs. And if you count the year rings, you will see that a piece of wood like that have an age of 30 plus years. And then you have two possibilities. You can imagine you have a piece of wood. You can either put it in your garden or you can burn it. If you burn it, you release all CO2 here and now, contributing to global warming just like CO2 from diesel. If you live in your garden, nature is like it takes the same year to degrade and release the CO2 as it took to build up the tree. That's why forests are in balance. So it would take 30 years to release the CO2, and at the same time, a new tree could grow up and take it. But if you burn it, it's released immediately. So we need to take this into account. That's why our National Climate Council have clearly addressed that wood burning is not CO2 neutral. And then we have the black carbon and methane as a specific issue from residential burning contributing significantly to global warming as well. So in the Renewable Energy Directive, we need to get wood out as one of the renewable, or we can have it as a renewable source, but it should not be climate neutral, of course. And then we need to think about not only go to renewable energy, but going to clean renewable or healthy renewable energy. And that is smoke-free heating like wind, sun, hydro, and heat pumps.
All right, Cora, I think we need to wrap up. So just a little bit to tie it with the cities team that Mark opened up with. What can cities do? And I think we have an example in Denmark that, and some comments came up that people live with neighbors with wood burning. We had cases in Denmark, and now to tie it up to the case of our asthma patient here, people buy, we know in Denmark, I'm sure this is all over Europe, they buy a house in summer and then winter they see that their neighbors are firing up the wood, they have asthma, it comes back to this basic right. Do you have a right to clean air in your neighborhood, especially as a sensitive asthma patient or your children, even worse? To that right of the neighbors to pollute and burn whatever they want. That's how it is even in Denmark now, right? Can cities do more? Are they part of solution? Because we've seen some national laws that do not allow bans even in Denmark yet, right? A little bit of tie back that we really want to push more local solutions around the traffic, urban planning, greening, raising awareness, getting citizens engaged to co-create with their cities. Is this solution for wood burning as well?
Definitely. I mean, the cities are usually much more progressive than the state, at least the largest cities. We've seen that here in Denmark, where clearly the majority wants to ban residential wood burning. The same in Frederiksberg, where you live, Savannah, they have the same opinion, and the same with the large cities, but they cannot due to national legislation. It's okay with EU legislation. There is actually no problem. The European Environmental Agency, they have what they call a solid fuel ban as one of their key recommendations to stop pollution from residential burning. So the only chance is the national regulation allowing cities to be progressive, and then it will spread to minor cities. When first the large cities do it, other cities, they want to do it as well. So cities have a key role here because the political parties represented in city councils, they are the same parties usually being in the government. Maybe not having the majority, but at least being in the government. So the politicians in cities can definitely talk to their colleagues in the national parties and then really try to get a much more ambitious legislation, allowing them to fight air pollution, not only from residential burning, but from traffic as well, and promote healthy traffic. So this is the key solution. Sometimes we see that municipal politicians, they don't always think like that. They see a little that the state is kind of the enemy, but the state and the government or the opposition is actually usually having some of their politicians from their own parties as well. So talk to them. They should be your allies, and ask them to give questions in the government, and then you can get the focus on air pollution in many ways. we convinced one of the politicians in the Danish government to ask how many Danes die every year due to air pollution, due to water pollution, and due to soil pollution. The question was, and drinking water pollution, we cannot say that anybody died from drinking water pollution, neither soil pollution. It seems to be nobody. But 4,200 people, that's 8% of all Danish deaths, they're related to air pollution. And this was extremely strong in the parliament, where politicians, they are not like us. They don't have the same background. So they just believe soil pollution, drinking water pollution, air pollution was kind of equally large problems in relation to public health. And this really turned the debate. So you can do a lot as a politician if you can talk to your colleagues and make them ask questions to the Minister of Public Health or the Environmental Minister, or which one is the right in your country.
Thank you, Kåre. Excellent speech and great discussion. So with this, I would like to wrap up the morning session. And just to make a few reflections, I would like to stress that we have covered as the key issue here is health in the center. Air pollution remains the major challenge to our health, arguably most important for people that already suffer from asthma, children, and the most vulnerable groups, as we heard from testimony for Greece. We still have around Europe, in East and West, people who daily are challenged to go about their daily activities because of air pollution. Air pollution affects everybody who's healthy and not healthy equally. And we have been too slow to implement solutions. We still have too many people getting sick and dying of air pollution all across Europe. Cities moving on as the key partners in solving these problems. Mark introduced us to a lot of the urban planning issues that this is a way forward. But the missing link here is how to incorporate health in the urban planning, in transport planning, in how we design our cities, in how we build our streets. And there are a lot of opportunities. I think we can all see this as opportunity to speed up the changes in the cities, to clean the air and provide healthier, more exciting and nicer environments to live in. And with Kåre, we turn also to wood burning, maybe a topic that we have less awareness of, less knowledge on, and maybe a little more uncomfortable to tackle by politicians, because it's also something that's cozy and that we attach to a little bit from some traditions we have from the past, perhaps in the Nordic countries. So I hope that this patient conference encourages everybody to speak up on these issues. I think education of patients and medical societies and their spreading of this knowledge to public from small communities where you live, with your neighbors, with those who burn word, from yourself. This is a way forward. If we engage our communities and cities and inform people more about the health risk and why the health argument is the most important to go for some wood burns, to get less cars in our neighborhoods, to put more green trees. I think this is a common sense that will prevail and push our politicians to also go in those directions and take bold decisions. With this, I will close the morning session, or give actually word to Phil to introduce us to the lunch and then the afternoon part of the program. And I want to thank again our excellent speakers and patient testimony for extremely important and nice first part of the day. Thank you.
Thank you, Zorana. Thank you for sharing the chairing and for giving your summary of the morning and your expertise. That's great. It's a shame that Natalie is not here. We wish her well. Hope she gets better soon. It does mean we have a little bit of extra time for lunch. So we'll have a lunch break of probably about 45 minutes now. We'll come back at the same time because the other speakers for the afternoon are teed up for that time. So yeah, just again repeating, thanks to Zorana and for all the speakers this morning. And we're going to go on after lunch.
Okay, should we get started with the event then? So when you're ready, Phil and Barbara.
Okay. So I hope everybody's back. Hope you all enjoyed your lunch or coffee break, whatever you did, or went for a walk or a cycle ride, or just hope it was good anyway. Welcome back. So the first thing I need to do is to introduce Barbara, who's going to be the co-chair for the afternoon. Barbara, do you want to say a couple of words about yourself?
Sure, thank you, Phil. And good afternoon, everyone. So my name is Barbara Hoffmann, obviously, as you can tell. I'm professor of environmental epidemiology at the University of Düsseldorf in Germany. I'm a founding member and chair of, and past chair of the International Society of Environmental Epidemiologists, of of the European chapter, and I've been chair of the ERS Environment and Health Committee, and currently I hold the position of Advocacy Council chair of the ERS Advocacy Council. So in these functions, I have tried to contribute to clean air policies in Europe and beyond, and this is also what we are going to talk about this afternoon. So first of all, just as a quick introduction into what's coming, I think the importance of clean air policies cannot be overstated. I mean, clean air is the most basic requirement for keeping your lungs healthy and for preventing disease. And for those of us who already suffer from lung disease, clean air is an absolute must-have for effective therapy and for prevention of worsening of disease. We heard the impressive statement from Maria and her mother Marta this morning that really made this become very clear. So what can we do about it? And this is what we will talk more about in this afternoon session. We will specifically address different levels, like the local communities, the national and the European level, to discuss and hear about options to improve the situation. But before we start with the afternoon session, I think Nadine has prepared a little game, interactive game. And so I'm happy to hand this over to Nadine, who is going to lead you through the little quiz that we have prepared.
Yes, thank you, Barbara. If I can ask Isaac to share the screen once more. We prepared an exciting quiz for you all, just to come back into what we learned this morning and what we might already know about air pollution and why it's so important for us and everyone around us. As you can see here, you can join the quiz either on one of your smartphones, but you can also join on your computer. If you use your smartphone, you can scan this QR code, which should bring you right to the Mentimeter quiz. If you're using your device, you can join the link that I sent just right now in the chat. I'm just gonna wait a couple of seconds for people to scan the QR code, and then I change my screen to the presentation. So all of you can also see the quiz on your screens while joining this webinar.
So Nadine, I've just tried to do that. It tells me that the quiz is not open yet.
Oh, then I have to start it first, probably. Does it change now?
Let me check. It works for me now.
Perfect. Then I'm going to share my screen and share you this one. All right. Can everyone see? Well, you should also be seeing this on your screen as well, your own screen. And then let's get started. So the first question. Welcome, everyone. We have 25 players already. How great. 26. Just going to wait maybe a couple more seconds to see if more people join. All right, let's start with the first question. Hey, sorry. How many people are affected by respiratory diseases globally? You have 3 options and you can choose one. Which one do you believe is correct? Wow, it seems that we have 5 people who guessed it correctly. Instead, we have estimated to have 2.73 billion people who are affected by respiratory disease globally. You ready for question 2? What percentage of people are exposed to unsafe levels of air pollution? Is that 99%, 73%, or 45%? It's 99% of people are exposed to unsafe levels of air pollution according to the WHO standards. All right, let's see what the score is so far. We have a shared first place, I see. Yes, Katie and Stingelicious. Well done. Then we're moving on to the third question. On average, what is the loss of life expectancy due to air pollution in Europe? Do we estimate to have 7 months lost, 1.2 years lost, or 2.2 years of lost life expectancy? 2.2 years, well done. A lot of people had this one right. Okay, and then we come to the final question of the quiz. If it allows me to share it at least. Yes, here we go. Which of these lung conditions can be prevented by reducing exposure to fumes and dust in the workplace? Again, you have 3 options, and you can pick which one you believe is affected by dust and fumes in the workplace. Well done, everyone. Okay, and now the moment of truth. Congratulations to Katie and Stingelicious. Well done. All right. Then, Barbara, I will stop sharing my screen and it's back to you.
Yeah, thank you very much. This was fun. And I'll directly hand over to Phil, who's going to introduce our first speaker in this afternoon session.
Yeah, thank you. So we'll now turn our focus to what we can do to make change happen on a local, national, if not a global scale. Just a reminder, once the speakers are presented in the given session, there'll be time for joint question and answer sessions. So as this morning, please continue to put your comments or specifically your questions in the Q&A box, and Barbara and I will field them at the end. So to open this session, we'll hear from Mark Hayden, who's from the organisation Ride for Their Lives. Mark's going to talk about their project and how to engage healthcare professionals and patients in advocating for clean air. You can see his biography on the little screen there, so I probably won't read it out because people can read it for themselves. And hand over to Mark.
Thank you. I just need the screen share. How is that for everybody? Can you see my screen?
Yep, you can see. Thank you.
Perfect. Thank you so much, and thanks for the invitation. I just tanked completely on that quiz. I'm ashamed to say. So I think the main message from that is I'm certainly not an expert in pretty well anything I do, and that really comes through in my day job. As a pediatrician, I'm always learning, but sometimes things go well, and I want to share with you some of the things that have gone well with this campaign. So Ride for Their Lives is a group of healthcare workers, people who work in hospitals, people who work in health in any way. It's not specific to any particular groups, who came together in 2020, November 2023. And I think often, as people say, stories are important. So I will be telling this as a story, really, as much as anything. So this is Vince. Vince in our hospital, Great Ormond Street in London, is the CAD manager, which is something to do with computer-aided drawing, and was also heavily involved in bike infrastructure. And when we were sitting down talking about bikes and talking about the climate health emergency back in 2020, he came up with the idea of riding to COP26 in Glasgow. And we all thought that was a stupid idea, as you might imagine, until the sort of idea took hold and we decided to do it. And the background to that was really, we felt COP was in the UK. We understood that COP was not the solution to anything, and I think COP has got a lot worse since then, but it's often been a greenwashing exercise. But we felt a level of responsibility, as it was in our home country, to do something about it and to bring the health message to COP. And this was one of the first COPs where health got an inkling in the door, and then more recently it has managed to expand. And the other reason was that just a few around about this time, a coroner in London said that we as doctors and nurses had failed a young girl called Ella Kissi-Debrah, who we heard about earlier in the talk, by not telling her mother about the risks of air pollution and the impact that was having on her. So that's where the story started. We got together a bit of a campaign. We got this very nice little blue satchel which we could carry messages in, and the messages written on the outside were written by children in our hospital. Our youth engagement group helped us with that, and you can see most of the messages written by children on this bag are a lot more hard-hitting than most of the politicians or the fossil fuel advocates who go to COPs say or do anything about. So we were trying to represent the voice of children as paediatricians, although we do have adult care very much involved in our group. So we felt that we were carrying a message and using that as an engagement tool. And the ride was just a way of doing so. We've always tried to be inclusive with regard to riders, and I think that's one of the problems with cycling. Whenever you start talking about cycling, people feel excluded automatically if they're not cyclists. And then even within cycling, you have subgroups based on age or fitness or ability, or all of the other divisions that we have in daily life. So we tried very hard from the beginning to avoid that and to be very inclusive. It could have easily turned into a bunch of consultants riding, and we specifically discriminated against that group, which I felt comfortable doing, as I was one of them. And we also pushed throughout to try and be very inclusive in the bike type. The bike in the second one from the left at the top is my bike, or the bike I rode for that. And it's an electric bike because I'm really not very fit. I would have never considered riding from London to Glasgow on a normal bike. You know, I'd ride around London, but I wouldn't have thought I could ever do it without an electric bike, and I'm not sure that I could. And equally, we've tried to be inclusive of all of the bike tribes based on bike type, including people who couldn't join the ride, but joined the ride on static bikes. And I think that's very important because, you know, being part of a ride or being part of a group, pushing to achieve something, and then resting and relaxing and talking together is really the sort of message that we're trying to bring. And I think it's similar to how we have to work around the climate health emergency or the air quality crisis. It can be very demoralizing. You feel like you're on your own. You're the only person climbing this hill, and at times you will be the only person climbing the hill. But knowing that there's people with you, riding with you, sharing food with you, sharing the problems, working together is really the SOP, I suppose, of what we've tried to do here. So that was our first ride back in 2021 to COP26, I think it was back then, and we got a reasonable amount of media coverage. And the thing we did right from the very beginning was we engaged with the World Health Organization. I hope we weren't the cause of President Trump withdrawing from it the other day, but if we are, I would feel proud for that to be the reason. Dermot Campbell-Landrum, who you can see in the picture at the front, has been one of our main co-riders and people that we've worked with, and we were really lucky to find him right at the beginning. He actually rode from Geneva on the first ride to London with a message, which I'll show you later, from the WHO, which is what we carried. And that's again the message we've tried to go. I think most healthcare providers would feel they're not, or workers would feel they're not experts in climate science or experts in air pollution. And so we've tried very hard not to reinvent any messages. We've tried to amplify the messages that are already there and try to translate them, I suppose, for the audience that we were talking to. One of the speakers earlier showed some maps of where pollution is bad, and on this ride, which we did from London to London to Naples in 22, I think, if I've got it right, for the COP that year, although we only got as far as Naples, we didn't get to Egypt. We rode through this huge pollution event, which I think is very common up in the north of Milan, but I didn't really know about the geography or the industry then at the time. So I didn't bring any of my asthma medications because I'm a well-controlled asthmatic. Once in a blue moon, I need a little bit of dilator, and I rarely use preventers. I'm very lucky in that way. But when we got to the top of the hill on between Switzerland and Italy, we looked down and we go, oh, it's raining. We put our rain gear on, expecting to ride down into heavy cloud and rain, but it wasn't. It was pollution. And by the time I got to the other side of that pollution, I was coughing and spluttering, and I had to find a nice pharmacist who would sell me some inhaled steroids to get me out of that mess, which was partly my own fault for not traveling safely and anticipating and planning, and partly the fault of geography, but also partly the fault of, as we've heard, wood burning industry and transport in that area. I mentioned earlier in the talk this health argument for climate action that we took in the first ride from London to Glasgow, and it was signed by Dr. Tedros. And then again in the ride in 22, when we went via Geneva, we got to meet with Dr. Tedros, and he rode a borrowed bike with us for a short way around Geneva. He sensibly brought his daughter, who you can see in the picture, and it was that riding together, and we chatted about what riding is like in Ethiopia, where he comes from. It's that way of cross-communicating, I think, that works for the little campaign that we've tried to do. We've also, as I said, always tried to work with either experts or people that can help us, people who are expert either in cycling or infrastructure, people who are expert in the underlying problems. And we were actually supported by the European Lung Foundation in a video that I'll show you shortly for a ride we did in 2023. Probably the main group we've worked with is the Royal College of Paediatrics and Child Health, who are obviously the main body for our group or our hospital, but there are many hospitals involved. And I think that collaboration has been one of our most successful outcomes of what we've done, because the president of the Royal College of Paediatrics and Child Health, Camilla Kingdon, actually rode with us for part of the first ride that we did. Soon after that, they created lung fellows or clean air quality fellows. Those fellows are doing their work now. They've produced resources that are fed back to us and been super useful to the work we've been doing. So that sort of collaborating with anyone who's trying to do the right thing is the other diversity we've tried to include. We haven't said that one group or other particular subgroups are the way we want to work. We want to work with anyone who can help. So I think the World Health Organization, the RCPCH, have been the key. If it was me, I would have been a bit snooty about the UCI, who are the sort of cycling racing body, very much lycra clad. But we've tried very hard to not be exclusive, and I think that has achieved ends that you'll see later on. Somebody mentioned the ULEZ earlier in the chat, and I think Mark talked about it in his talk as well. The ULEZ was hugely controversial in London. It's come in, it's working. It's not the solution to everything. Once you take one step forward, you need to take further steps forward. But I think one thing it showed is that action on air pollution can be politically popular, or can not be a political suicide, which is, I think, how it's often viewed. So the ULEZ is a zone where you get charged if you don't have a car with a certain age or a certain emissions type of thing in London. It was initially very small section of central London. Maybe if you'd sort of did Camden and Westminster and Greenwich on this map, you would have had the original thing. Then it extended a bit further out. And this event, which I was invited and allowed by my hospital to speak at, as long as I didn't say the word ULEZ, was when Sadiq Khan, the mayor of London, announced the expansion to the outer suburbs. And this was probably the most controversial episode. And we could see partly why, because we chose just before the ULEZ came in to ride around the edge of the ULEZ as a group, which took us 3 days to do because it's quite a long way around the outside of London. And you're at times riding through what you would call countryside, which people would all think, well, it's not polluted. Well, maybe that's true, maybe that's not true. And obviously the exact edge is controversial, but I think that was part of the issue. It was starting to encroach on what people see as a open area where they should have the right to drive their cars in any way they want. So it was an interesting time. Some of the people pulled out of this ride because of death threats, but we got round, we were safe. We got some good media coverage of healthcare workers celebrating the ULEZ, which was an unusual story at the time. And I think really that's the role that healthcare workers can have in the advocacy area, actually standing up, speaking up, doing things like this. And I think that's an important area. But obviously, talking to families is our main job. So I'll come to that a little bit later. But I think this was a good thing that we did in the ULEZ. Now, this is a video. It's about 3 minutes, but that gives you a bit of a break from listening to me. Please shout out if the audio is not coming through, but I've tested it a few times, so it should do. And this video was supported by the organisation who are running today's event. And we're very grateful to them for that, because it allowed us to document a ride we did down the Pyrenees to Barcelona. And the video is self-explanatory, so I'll play it now.
Have had any concerns or think about air pollution, or have talked about it maybe in your classes or to your family? Oh, fantastic!
estan creixent i aprenem moltes coses i com som petits respirem més fàcilment la brutícia que hi ha a l'aire i que
So the Busy Bus, the ideal is that kids are going on their bike to school in groups. They're protected by the police, so they can actually, cycle freely. The parents are there, and it's a wonderful experience, for kids to be on a bike. I mean, they're all so happy. Physical activity before they start school is so important because it activates the brain. There's very little air pollution, so this kind of initiatives to involve the kids and the young kids are very important. We did a study here among 40 schools in Barcelona where we measured people's cognitive development. And what we found that the kids that went to school with a higher air pollution level had a slower cognitive development. So there was quite a significant difference. Should we expose our kids to air pollution? No. We want to have smart kids. I mean, we want to have kids with good brains.
Okay, so thanks for watching that. I hope it was useful. I'm coming towards the end of my talk. I've gone over slightly, but I was encouraged to do so. But we're nearly there. This was another ride we did last year again with the Royal College of Paediatrics and Child Health, where we helped people ride to the conference as opposed to fly, although very few people would fly to Birmingham in the UK, but conference travel is something that people do sometimes choose less than perfect modes, and sometimes they don't need to. And then this was another ride we did last year, and I can't remember the name of the pretty little girl in pink, but Rosamond is the lady on the right, and Rosamond is Ella Kissy Deborah's mum. So we organised a ride in Lewisham, and we'll probably organise another ride this year. We've got a plan to meet up and talk about how we might do that. Really to celebrate Ella's life and the impact that Ella had on me and many others, bringing home the message, that personal story around air pollution, that the figures don't work. The WHO talks about 7 million people die a year, 37,000 in the UK. People are immune to that information. We need stories backed up by figures and science, and I think that's what we've tried to do. So we're very much looking forward to the ride for Ella this year. The other thing that we've done by collaborating and not being exclusive and snooty about sports is one of our riders rode with Chris Boardman to Geneva for the Olympics. She's a bit fitter than me. And he kindly sent us this video, which again, I'll just play. It's much shorter than the other, of his message to us on the ride to Ella last year, the ride for Ella last year.
We actually know that air pollution kills around 30,000 people a year, a staggering number that we routinely ignore, because that's how we're built as human beings. We struggle with anything that isn't immediate and very personal, which is why it takes tragedy to emotionally connect us, to make it personal. And that's why Ella's death, Ella's life, gives us the opportunity for change, to stop us looking away and moving on without action. I'm really sorry I can't be with you in person. I'm up in Scotland. I'll be riding with you in spirit and thinking about you as I go out my bike today, because it matters. The 30,000 reasons, and for one, Ella.
Okay, and I think that brings home the message. Chris Boardman's some cyclist, apparently. I don't know about such things, but you guys might have heard of him. These are the rides that we've done so far. As you can see, they're distributed all over the world. Obviously, we haven't been part of them, but we ride as many as we can that are within our range, and then support people who want to organise rides with our website, with advice, other helpful things to get rides going. So over the years, all of the different dots are different colours. These are the rides, and if you were interested in using this as a way of engaging with healthcare and families, we'd be very helpful. I'd be very happy for you to reach out. And then finally, as far as outcomes, there's been lots of outcomes. Some of our people have become politicians, many different outcomes. This is probably the one most personal to me in my hospital, Great Ormond Street. Because of this, because of Ella and because of this, I managed to work with our electronic medical record team to create an alert. I don't know if my pointer's showing, but there's an alert in the lower left corner that shows the PM2.5 and the NO2 level for this imaginary patient, Mark Gardner in this case, where he lives, for his postcode. And this shows to all clinicians, every time they open the chart, they can see what their patients' pollution levels are like. And then, as I said, we're not experts. We've linked to the Royal College statement here, and we've put in the WHO guidelines. What we're trying to do is to stop clinicians looking away. It's very easy as clinicians to look away from problems that we see are too big for us. But we know that parents want to know about this. We've done surveys, so this is the start, and soon, and we'll be displaying this information direct to parents and children. But we wanted to start by educating our clinicians and developing support. And as you can see, last year we got some coverage in the newspaper. So that's the end. I'm going to stop sharing my screen now. There's a QR code for our organisation. You're welcome to follow that or to email me personally or ask questions in the chat. The one thing it does is it brings us joy and it sustains our hope, which is very difficult in this difficult time. Thank you.
Thank you so much, Mark. And this was an excellent presentation and very, very impressive and moving. And I can only speak from personal experience and underscore what you are saying, that cycling makes me happy, and even more so if it happens in a healthy and safe environment. Just as a reminder, we will have question and answers at the end of the session, so please write down your questions in the Q&A column. Usually we would have had, I would now turn over to Margaret Charlotto from the European Environmental Bureau, but unfortunately she is sick and cannot talk about policies at the local level, at the community level, on how to improve air pollution. So first of all the best to Margaret from here. Get well soon. And instead, I'll just give you a very quick overview of something that I found quite interesting. When the new Ambient Air Quality Directive, which is the new European law on air quality, was passed a few months ago, I found it quite interesting. They have, in one of the annexes, they have a list of measures that are to be taken by the communities when they, draw up their new air quality plans and roadmaps for cleaner air, and that they're exactly listing all the things that we've been talking about. I mean, these are now in the annex of the new law we have in Europe, and I've just looked at it, and I'm just going to highlight a few of these issues. And it's exactly what we've been talking about. It's the cities now will or are encouraged to uptake zero and low emission public transport. They are encouraged to start zero and ultra low emission zones. Some very concrete measures that are suggested is congestion pricing, parking fees, then implementation, establishment of low traffic neighborhoods and car-free streets. They suggest as measures to be taken by the cities, car sharing and carpooling, incentivizing bicycling and walking, planning for compact cities so that bicycling and walking is possible, and further measures to encourage a modal shift away from combustion engines towards active mobility by walking, cycling, public transport, and the rail system. So all the things that we've been talking about, they are now listed in the annex of our new Ambient Air Quality Directive. And this will also give us a very good information or very good basis for advocating for clean air policies in the local communities, because it's already in there in the new law. So with this, I'll hand over to Phil again, who is going to introduce our last speaker of the day. Please, Phil. Phil, you're still
somehow we got muted there. I was just saying thank you. It's on to the last bit of the day, but actually I don't want it to end because there's so much interesting stuff here. I could go on listening to this and getting more inspired all the time. So we come to our final presentation. We'd like to invite Catherine Wiley, who's the Stakeholder and Public Engagement Manager for ELF, to talk about the Healthy Lungs for Life campaign. Again, Catherine's wee bio goes on the screen, so I won't read it out for you because you can all read for yourself or have it translated if you can't read English. So Catherine, it's over to you.
Thanks so much, Phil. First, I'd just like to say I'm also a little bit ill today, but as everyone seems to be, so apologies if my voice isn't as clear as it needs to be. Is that presenting yet? Okay. See?
No, we can just see the
apologies. I'll try again.
Programs, right? You've got your lovely picture on, but there we go.
There we are. That's the one. Okay, so Healthy Lungs for Life. I was just thinking, because we've had such great talks today, and really thank you so much for everyone. It's really been inspiring. And I think just coming off the back of Barbara's point, we've got the AAQD that came in, and we've got these new policies to implement at city level. But the reality is a lot of these are incredibly unpopular. Anything to do with sort of traffic measures, unfortunately, these kind of restrictions have huge backlash. And as Mark was mentioning, you know, people had to pull out of some of the campaigning around ULEZ because of death threats. And that, you know, that's very serious, and that was the level at which it got to. And how do we combat some of that? Well, Healthy Lungs for Life on its own certainly isn't going to be the way to combat all of it, but that's not the claim I'm going to make. But public engagement, public education, and bringing on board really is. And so hopefully today I'll be able to talk about some of the work we do with Healthy Lungs for Life, and you'll see how it is a tool for public engagement alongside all of the other campaigns that people are running, like Ride for Their Lives, and you know, the multitude of other amazing things that different organizations around the world are doing. All together can create the right level of noise and engagement to hopefully help. So Healthy Lungs for Life, we focus on raising awareness and promoting action on the issues that can prevent lung disease. And here we've got our 5 key themes. So the Breathe Clean Air is incredibly important, obviously, and is a lot about today, but we do have other themes around Be Smoke Free, take the active option, so being really physically mobile and fit, vaccinate. It's really important to get the correct vaccines and fight climate change. We'll also be introducing the topic of nutrition as well, because that's also something that's really important to help prevent lung disease and other NCDs. To raise awareness, we have lots of education tools, and we run these large events which run alongside the ERS Congress each year. So this is how we really started Healthy Lungs for Life 10 years ago. And it being 10 years, it's given us a really good opportunity to look at what we've been doing, to reflect, to see what's worked really well, what we're proud of, and also to see the way in which the campaign has moved kind of organically over those 10 years and what it is that we actually now want to focus the campaign on for the future. So the ERS Congress is a really powerful tool for public engagement. It brings 20,000-ish people to the Congress city each year. Now, those cities are in Europe generally, or always actually, sorry, in Europe, but they've covered Vienna, London, Paris, Milan, and we're off to Amsterdam in 2025 again. And what we do traditionally alongside the ERS Congress is that we build this sort of large area where people can come, the public can come and have a lung function test, so with free spirometry testing. We've also worked with local organisations to sort of create a nice story around this, to maximise some of our media outreach, and we put quite a bit of money behind advertising as well. So everyone sees the Healthy Lungs for Life campaign, they can come and get this free spirometry test, and they can learn a bit about the importance of lung health, and also what they can do to protect their own and others' lung health. We've built a bit on that, and we now also include scientific public and workshops and seminars within the Congress itself, and also alongside the Congress. And we also we organise a run or a walk, just again to bring attention to the importance of good lung health and the campaign itself. But we've started doing more and more of that's even beyond this Congress, because we saw how people were drawn to the spirometry, to the free lung testing, and how they were able to then, or we were able to then have that moment with them to talk to them about the importance of lung health and give them these materials. So beyond the Congress, we've now been going to offer city level spirometry events for mayoral initiatives. So exactly like the introduction of clean air zones and traffic policy. So last year we ran events in Stockholm, and we also went to Milan to talk to a coalition of mayors, the C40, on how they could use not just the campaign, but also how they can engage the different networks of patients and healthcare professionals to support these messages and to really get that information across that clean air is incredibly important for our health, and we need to have these policies that can help to create clean air. We've also supported advocacy actions at national and EU level as well. So we did quite a lot of work with many other organisations for the Ambient Air Quality Directive in 2023, and also followed up in 24, and still are doing. And we look at any other ways in which we can work with other organisations to help support these messages at these top policy levels. Alongside those two, we also go into schools. It's hard to change the hearts and minds of people when you've got very much set in your ways, and so we are aware that the behavioural changes that we want to see in our society, it's definitely better to engage young people and children, and that way we can, from a very early age, kind of engage them on lung health, understand the importance of their lungs, what impacts their lungs. So we run programs that educate them on air pollution, and also against smoking, which is very, very important. And we've been running micro grants for several years now, of only €1,000 each, and we give these to our global partners. So the next round will be launched in March this year. And if you're interested, there will be an EPAP live event, which will talk a lot more about the grants and what we're looking for this year. So whilst €1,000 isn't a transformational amount to most of our European partners, our global partners, it really does give them a real foot up with the campaigns. We've seen some really amazing outcomes from these quite small grants. But I mean, how can Healthy Lungs for Life be a tool for advocacy? Because this is kind of what we're trying to get at here, this public engagement tool, these big events. What can it actually do to change anything? So by organising these big lung function testing events, I've already kind of mentioned it brings in these networks of professionals and patients, and also other local organisations like local government, local schools. And bringing all of these stakeholders together and building these relationships is really important if you want to start to make a real change in your local community. When once you bring these networks together, you engage and inform them, and you inform the patients, you're working with the professionals and the public. You create materials that are really suited to them, and you translate them into the local languages. That's really important. And you actually co-create when appropriate or when possible as well. And then from these 3 steps, you start to create advocates who themselves want to promote lung health and ask for better policies to protect lung health. And then you have this lovely cycle, because then you've got these people who are very passionate about lung health, who want to make a change, and then they can organize a public lung function testing event, and then it goes through the cycle again. And by this, you can start to see these sort of advocacy networks start to build as we work with more and more organizations in different countries with different stakeholders. And over 10 years, you can really now see the difference that that has made. And obviously, we hope it continues for a long time. But one of the keys to that is ensuring that the campaign has been really replicable. If you want to go on our website, then we have templates for every aspect of the event and toolkits that will help you organize everything. It includes all of our information resources, which are translated into several languages. We don't always have all languages, but if you want to run a Healthy Lungs for Life event and we don't have your language for the information resources, let us know and we will see if we can get them translated for you. And again, just going back into the microgrants, though, for some organizations that don't have the resources that would really like to run something on maybe a larger scale, do apply to our microgrants, and hopefully that will help you to set up your own spirometry or lung function testing events and get across these really important messages on air pollution, tobacco, climate change. I've also I briefly mentioned already the Healthy Lungs for Life at schools, and we've got some nice photos of the project in action. We had been running some classes with the materials in schools for a while, but actually 2024 in Vienna was the first time we actually delivered the lung function testing alongside it. The pupils were very engaged, especially the younger pupils. I think there's like a sweet spot, sort of 8 to 12-year-olds. You'll be very excited to hear from healthcare professionals coming into their classrooms and really engaged with any of the activities that we're doing. Off the back of those, we've got the young people, the children, to write letters to local politicians and MEPs. So that way you're already kind of encouraging them to advocate for themselves and advocate for their needs. And it was really powerful. They really enjoyed doing that. And we've now got these lovely collection of letters and also pictures for the younger children, which we will take to the European Parliament in 2 weeks' time and present to some of the MEPs there. So over the last 10 years, we've really expanded our activities, and over the next 10 years, what we want to really see is, as well as continuing everything that we've talked about, we want to support research or continue to support research into the role of spirometry in monitoring lung health. We want to scale for greater impact. So this again is talking about working with other organizations. We all have limited resources. We can't grow much more than we already have, and it's impossible to deliver all these events with a very small staffing team. But we really want to work with other organizations who are interested in engaging with us and seeing if there's something that they can deliver using our materials and vice versa. And so we're going to really see how we can build upon those relationships and also measuring our impact. It's really important to measure the impact to show that it's worth to continue doing this. And I think it's really hard to measure impact when it comes to behavioral change. But we do know that it works. We do know these campaigns work. So we're going to really look into what we can do to demonstrate that more accurately with facts and figures, especially when you're working in the science. Well, I'm not a scientist, but if we're working alongside ERS, then you really do need to show a bit of methodology behind what you're doing. And I just wanted to finish on this really nice quote from Maria Neira, who we've been working with a bit over the last couple of years. We will be going to Colombia in March to deliver Healthy Lungs for Life, which will actually be Healthy Lungs and Heart for Life, because we're working with the World Heart Federation on this occasion to show how air pollution doesn't just impact lung health, it also impacts heart health. And heart health is something that gets a lot more attention in the press. So that'd be great to be able to show those links and hopefully get more communities and more people involved. And And Maria gave us this quote for our 10-year report, just to say Healthy Lungs for Life is an essential initiative to highlight the harmful effects of poor air quality on our health and to help prevent its impacts. And it's this, and again, she goes on to say that the community, as communities, we must collectively demand clean air. And that's so right. It's no one person can make this change. I think we all have a passion. We all definitely want to work together. So yeah, let's see what we can do over the coming years. Okay, thank you. That's the end of my presentation.
Thanks, Catherine. That's the end of all our presentations. We've got a few minutes now for some questions. I'll give people a couple of minutes to start putting them in the Q&A session. There's lots of kind of thumbs up and applause for you there, Catherine, so that's nice to see. But while people are thinking of the questions, just one thing occurs to me, something we've talked about kind of other times here, is following on from Maria's observation that, of course, this air pollution affects every part of us. Are there other kind of condition-specific networks that are working on this issue at the same time? Because this is the European Lung Foundation. Is there anything equivalent in heart or dementia or anything like that?
I think they're beginning to, and I think they're a bit behind us only because the impact of air pollution on lung is so apparent, and the research was, I guess, there much earlier. I mean, Barbara, you jump in if I say anything wrong, please. But I mean, we definitely see cardiologists now getting more involved. Like I say, World Heart Federation will be working with us in Colombia, and I think, I think that we'll see more and more of these kind of activities coming from these large professional networks as well. I hope so.
Yeah,
Barbara,
if I can jump in here, I think. I mean, traditionally, the respiratory societies, the ERS in Europe and the ATS in North America, they have made this their topic because it's so obvious, as Catherine said, that of course, if you inhale air pollution, it damages the lung. And it's only been for the last, not much more than 20 years that first studies came out showing that actually heart disease is being caused and worsened by air pollution to a great extent. And it's quite new that we now know that brain health is being impacted by air pollution, that diabetes is caused by air pollution. These are all very comparatively recent findings, and because we have known about the lung, air pollution and lung for so long, most of the activities lie now with the respiratory societies. But as Catherine already said, it's important that the other societies also get aware of this and go out, let their membership know, and also contribute to advocating for clean air policies. So it's something where we all need to get active and need to talk about it.
Oh, thank you. Mark, you've put your hand up. Do you want to chip in?
Yeah, I just wanted to support what Barbara says. I mean, I think we really need to thank the respiratory societies, for what they've done. But I think the rest of medicine has dropped the ball quite significantly. But they are coming around now as the research comes through and starting to realise that. Although I think clinicians still feel that air pollution is a problem for public health and not actually a problem for doctors that work in hospitals and GP surgeries, which is obviously completely wrong. So that's, I think, a big message that we need to do. But the Royal College of Paediatrics and Child Health, which I'm very peripherally involved with, Royal College of Physicians, which I'm peripherally involved with, is about to produce their second report. Their last one, Every Breath We Take, I think, was quite a few years ago. And that will definitely cover off dementia, stroke, heart disease, all of those sorts of things. So I think the colleges are perhaps coming round to that. But I think it does cause us a problem when we're talking to patients and families and the public to only focus on the lung. I think the lung is a great starting point, but how is it was explained in one of the talks earlier, how the lung is the portal to the body. and then it affects all the other organs, I think is a really important message. I've had people say to me, well, I know air pollution, that everyone says this, but there's only one girl in London who's ever died of it from asthma, and I don't have asthma. Why should I care? So that's the flip side to that personal story and the focusing on the lung. It allows people who don't have any of those diseases or don't worry about those diseases to go, well, it's not affecting me or my direct family and friends. I'm lucky enough to have a little bit of asthma, not much, decent coronary artery disease, early diabetes, and you can be the judge of whether I have early dementia or not in the way that I speak. But, you know, I think the message to move away from solely lungs is really important to impact the people who have power in the narrative, who are the taxi drivers and the middle-aged white men running newspapers and the people in Parliament. And I think there's some value in sort of focusing on that.
Great, thanks very much, Mark. Okay, there's a few questions appearing in the Q&A now, so I'll go to those if that's all right. First one from Jan Walpole said, what can I do personally to improve the air quality around me? Currently, I feel helpless. Thank you. To which Mark put on a response, they want you to feel helpless. Refuse to. Do what you can. Ride a bike, advocate to whoever will listen, which is a really good answer. But does anybody else want to comment on that? How to combat that feeling of helplessness? Barbara?
Yeah, thanks. Well, I can understand that. I can relate to that feeling very well. And actually, I mean, that's the dilemma we're in. It is not very much you can do yourself. That's why it is so important to advocate for clean air policies at every level, local, national, supranational, EU, you name it. And but there's a few things at least you can do if you want to influence your personal exposure or minimize it as much as possible. And for example, we have had, and now all the European member states will have to revise their air quality indices. So if you want to get active outside and you know that you have a lung condition or heart condition, you can check the air quality index and choose a time and a place where air quality is better. So very practical. If you want to go jogging, don't go jogging along highway XYZ, but go jogging through a park. I mean, that is very obvious, but I still see people jogging along major traffic roads in Düsseldorf, where I work. And I wonder why they do that. Another thing is you can choose times when usually air pollution is much lower. And you can check that with this air quality index. That's available now. So there are a few things you can do. Of course, you can avoid producing air pollution yourself, so that, you know, exactly what we talked about, whenever ride your bike, walk, don't turn on any wood stoves at home, things like that. So you yourself can avoid producing air pollution. Yeah, and then the most important thing then finally is go out and try to change it on a higher level. Go to your city administrations, to your representatives in the parliaments, and talk to them and produce pressure. Because otherwise, if there's no pressure from the community, from the civil society, it will not change.
Thank you.
Can I just add quickly to Barbara?
Yes,
Everything Barbara says is absolutely correct. And it is really overwhelming sometimes that we feel like we can't personally do anything. But the thing is, it's not an individual burden. And I think that's the thing to remember. These are things that need to be changed at policy level. Like, we can get involved in policy making and we can do things that we feel like other people should be doing too, but don't feel overwhelmed on an individual level, if you can help.
Thanks. There was another question which Mark has also answered writing, but I'll just read it out so that the other people have got the answer. Lisa McNeil asked, are there Bicky Bus schemes possible in the UK? Mark says absolutely, they organise 1 or 2 at their school, and there are some in London and Glasgow, and he's offering more tips by emailing him. So that's, without asking you to repeat that, Mark, that's, people can see that for themselves in the questions. And one more question here from Helen Wood. Is the EPAP micro grant solely for spirometry events, or are they for any kind of public engagement activities that raise awareness of air pollution and lung health?
That's a great question. Well, as Mark showed in his video, he got one recently. So no, it's not just for spirometry. It's for any, well, spirometry is a key part of it, but we also give money to other events that are creatively engaging people in lung health and improving awareness of the importance of lung health.
Thank you. So do apply if you think.
Oh yeah, please, and come to the EPAP Live in February, which Nadine, I think, put the link in the chat if you want to find out a bit more about it. We change the themes each year slightly as well, and I'm not sure exactly what the objective will be this year, but we should have 10 grants to give in across 2025.
Good. Okay. Well, thank you very much, everybody, and thank you for the questions and the presenters again. We're bang on time now to kind of go on to kind of the wrapping up sessions. I'm going to hand over to Barbara again.
Yes, thank you very much. First of all, thanks for all of your questions and input this afternoon and all the talks we heard this afternoon. I think it's been a very fruitful discussion, lots of information, lots of inspiring ideas, and ideas about how to engage, what we can do to not feel helpless. So just to wrap up a few of these very inspiring things, Mark gave us a talk about the Right for Their Lives activities and showed us examples how kids have fun and when they go out and get on their bikes. And I think these happy children that we saw on the pictures, that is just absolutely contagious. And such activities are one of the most impactful advocacy tools that we have at our hands. Then Catherine presented to us the Healthy Lungs for Life campaign with its various ways how they approach people and what can be done. So awareness raising, showing how important lung health, but also cardiac health and other health is, how people can get really hands-on experience with these lung function testing. That is always quite interesting and intriguing for citizens to do this themselves and to see how their lungs are functioning. And they learn about risk factors and how we can all engage to improve our environment. One of the most important messages I think that I got today was how important it is to work with children. They are still open and curious about new ideas. They embrace change. And of course, they're also our future. And anything, where we can put a seed into children will give us lots of results later on. So working with children is a very, let's say, fruitful place for our energies. And then we got some practical advice. How can we use lung function testing as an advocacy tool? How can you do that? Catherine showed us a few, or gave us a few very practical tips about that. Now with that little wrap up, I'll switch over and really want to say thank yous to many people who made this event possible today. First of all, I want to give a huge thanks to all of our speakers and patient contributors. to members of the event working group who helped plan it, and everyone who helped promote the event. And of course, all of you who joined us today. Then I would like to extend an invitation to keep in touch. We are seeing here ways to keep in touch. If you have enjoyed today's event and would like to hear more about future ELF events, you can also sign up to the ELF newsletter. You can follow us on social media, and you can also you will receive the recording of today's event. It will